Life is a tree and it roots its consciousness. Therefore, once we tend the root, the tree as a whole will be healthy. Keeping our body healthy is an expression of gratitude to the whole cosmos, the trees, the clouds, and the universe. Today's scenario in all our lives is the same. We may all be sailing in different boats, but the storm which has affected each one of us is the same. The storm of a virus called coronavirus. I, Maria, on behalf of IQAC cell of our college, in association with University of Mumbai, welcome our patrons, our chief guest, Dr. T.A. Shivare sir, Director of Education, John Wilson Education Society, management members of Vivek Education Society, esteemed resource panelists, the doctors, Dr. Bharat Bhel, Dr. Don Campbell, Dr. Sukriti Bhalla, Dr. Tanu Singhal, Ms. Niyati Dhawale, and our dynamic principal, Dr. Vijeta Shetty Madam, and our distinguished guests, our participants from across Pan India for today's international webinar organized on the theme Overcome COVID-19 Pandemic through Nuances of Life. I welcome you all on behalf of Vivek College of Commerce. Before we begin our program, let us all kindly rise for the national anthem.
जन गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you. May I now invite our supportive dynamic principal, Dr. Vijeta Shetty Madam, to give her introductory note on this first ever international level interdisciplinary webinar conducted by our college. Over to you, Madam.
Thank you, Professor Maria. Good morning to one and all across India. A very good afternoon to all in Australia, and a very good evening to all in Canada and US. On behalf of Vivek College of Commerce, I welcome you all for this international webinar on Overcome COVID-19 Pandemic through Nuances of Life. This is organized in association with the University of Mumbai. A little about our college. Vivek Education Society's Vivek College was established in the year 1986, and it is located in Goregaon, Mumbai, India. It is recognized as a vibrant institution working for the cause of the education. It offers various programs for the undergraduate and the postgraduate level, predominantly in the field and the faculty of commerce. It has produced one of the finest and the most disciplined learners who excel not only in academics, but also art and sports. One of the goals of our college is to sensitize the stakeholders in the happenings of the society. And in view of fulfilling this goal, we have organized this international webinar for all our stakeholders. The present COVID-19 pandemic continues to take a massive toll on the lives and the livelihood across the globe. The COVID warriors, the team of doctors, are working relentlessly to save every life possible. Expect the unexpected. In this time of uncertainty, has become a new norm of living. The present webinar is expected to achieve three objectives. First, to understand the COVID-19 pandemic and situation across the globe. Second, care to be taken during COVID-19 pandemic. And third, precaution to be taken post-lockdown. For this, we have with us our esteemed panelists of doctors who have taken their time for all of us today and who will be deliberating on this very issue. With this introductory note, I once again welcome our chief guest for today's webinar, Dr. T.A. Shivare sir, guest speakers, the panelists, management of Vivek Education Society, all the invited guests and the stakeholders for this webinar. Thank you and stay safe.
Thank you, madam, for that wonderful introductory note. Today we have our chief guest for this international webinar, Dr. T.A. Shivare sir, Director of Education, Wilson College, Mumbai. Sir is also chairman of Association of Non-Government College Principals, University of Mumbai, and also chairman of Forum of Autonomous Colleges in the state of Maharashtra. He was former president of Indian Commerce Association, New Delhi, former director of Indian Institution of Management, Hinduja College, Mumbai, former principal of KBP, Hinduja College of Commerce, Mumbai, former dean of Faculty of Commerce, University of Mumbai and Shivaji University, Kolhapur. Sir is an executive president at the Maharashtra State Commerce Teachers Association. Sir is former member of Maharashtra Public Service Commission. Sir is also a trustee of Shao Institute of Business Education and Research, Kolhapur. We welcome you, sir, for this first ever international level interdisciplinary webinar. Sir has given his message through a video. May I request our technical team to play the video.
Good morning, all of you. I must thank Principal Vijeta Shetty has called me as the chief guest of this international conference. I want to focus on 3 points. First, the health after COVID-19. Second, effect of the COVID on business. And last, there is the effect on education on a COVID. This conference, international conference, is focused on the health. Because of COVID-19, we are locked up. Now, all the people must know now, they are feeling also though, get together, stay at home, discuss the family matters, to share their love also each other. That is a lesson given by the Corona. It is a challenge and it is an opportunity. Because of this lockdown in Maharashtra, it is very difficult to conduct the examination because all the colleges and schools are taken by the government, Maharashtra government, for quarantine. I must request, this is a challenge before us, the teachers should change their attitude and give their lectures online or on YouTube or all the authorities. But sometimes internet facilities are not there in rural area. I must request also for the government of India that internet facility should be given the free to the education institute and all the students. Then they are really ready to accept this challenge of the Corona. I must thank to the Sri Ram, the President of Vivek Education Society, Mr. Sachi Verma, Secretary of Vivek Education Society, and Vijayda Shetty. She has invited me as a chief guest. And please stay at home, take care of your family as well as the society. Thank you.
Thank you, sir, for that wonderful welcome address. It gives me immense pleasure to introduce our first panelist, Dr. Bharat Bahl from Toronto. Sir is a staff emergency medicine physician, William Osler Health System, Toronto. He is a director of physician recruitment at Maple. Doctor has been instrumental in building Maple's Canada-wide physician network. He's been recruiting and training physicians from coast to coast. He's also been instrumental in setting up Maple's on-call network to provide 24/7 physician coverage on the telemedicine platform. Sir has been instrumental and the first physician in Canada to provide daily inpatient care and rounding services at remote hospital. He's been instrumental in using PI under Maple's groundbreaking telemedicine platform. He is a clinical educator, and it is never said doctors rise themselves in the service of others. All I could make out was the doctor is very close to classroom teaching and clinical hands-on teaching, which is a boost for us teachers also to promote wellness among our stakeholders. Doctor does the same. He has engaged himself in teaching residents with observed clinical teaching, teaching during his shifts and lecturing on various topics relevant to emergency medicine. And his approach to teaching is very simple. He teaches and engages students in his conversation and builds up complex topics from fundamental concepts. That's how we learn. His major approach and skill set is to teach residents to teach program to improve the learning experience of medical students during their family medicine rotation. Sir has achieved many awards. He's been nominated by his students for the Medical Student Teaching Award. Sir has attended many conferences, has many publications under his feather. He has presented in national and international conferences. It takes me proud privilege to welcome the first speaker, the first panelist for today's international webinar, Dr. Bharat Bahl, who is going to talk on a purview of COVID-19 in the global order. Over to you, Doctor, now. We welcome you once again.
Hi, everyone. Thank you for that wonderful introduction. I'm hoping to have a kind of big picture view of COVID-19 and how it's going to impact you and perhaps its impact on the global order as well. But after that, I also want to speak a little bit about my personal experience with this disease as well. And hopefully we can have an entertaining Q&A after. Can we move on to the next slide, please? Can we move on to the next slide, please? Perfect. So I just want to talk a little bit about COVID-19 and give you a little bit of a background about where I'm coming from. So I'm an emergency physician in Toronto, Canada. And for those of you who don't know what I do, it's basically I'm the first doctor that you see when you go into an emergency department. So I regularly get to treat patients with COVID-19, and I see the full spectrum of the disease. So unfortunately, this disease is exactly what you have heard on the media. It's highly infectious, it's potentially deadly, and it attacks multiple organ systems. We see people with not just breathing issues, but everything from heart failure and kidney failure as well. The disease is still being understood. For example, we are seeing new presentations of it, such as strokes in COVID-19, and we still don't understand exactly how it causes certain things, like causing people to lose their sense of smell. So it's still a disease that we're still learning a lot about. And of course, that'll also have an impact on how it affects the global order. So one of the big things is, how is COVID-19 going to behave in the future? Is it going to be recurring annually with different strains every year, much like the annual flu? Or is it going to be much like the Spanish flu of 1918, where it was present for a couple of years and then kind of just faded away? And how it'll behave will have a huge impact on our lives and our societies. Because if it does become like the annual flu, then it's going to have a very long-lasting impact on our society, our culture, how we socialize, and so much more. One of the other big factors in this equation is how governments will respond. And we'll talk a little bit about, for example, the government of Brazil, Brazil's response versus Taiwan or China. And of course, will these governments use scientific thinking to make their decisions, or will they resort to politics? And of course, we'll talk a little bit about the Canadian versus the American response to COVID-19. And of course, lastly, is the hope for a vaccine. At the end of the day, of course, no one really knows. Next slide, please. Can I have the next slide as well, please? Perfect. So the only thing that we know for sure is that COVID-19 ushers in an era of increased uncertainty. And that's something that your principal also spoke about in her initial address as well. And of course, those societies, corporations, systems who are able to learn quickly and adapt are the ones that are really going to be seeing, are the ones that are going to be thriving in this environment, because it's really changed the global milieu of what we do. Next slide as well. So I want to give you a great example of healthcare systems, and specifically I can give you some examples of our own healthcare system. So any healthcare system that has a proper vertical integration where the federal government, the state level governments, and the local municipal governments are able to coordinate their response effectively, those are the healthcare systems that are really going to be able to deliver quality healthcare in this time. One example from our own hospital, my hospital, for example, started preparing for COVID-19 long before it hit our shores. We started training for how we would be treating patients who are very sick with the disease. We started having simulation sessions where we trained with mannequins and had other scenarios that we worked through. We worked through different staffing models. You know, what if half the doctors got sick and couldn't work? How would we staff our emergency department in those circumstances? So we had a lot of preparation. And in spite of that immense amount of time and preparation put in, we had some surprising challenges. For example, we had a brand new emergency department that we had just built, and we still had the old emergency department intact. So when COVID-19 struck, we decided to use our old emergency department as an overflow department. Say if we have too many patients, we can always put the stable patients in the old department. So we had the old department fully furnished and ready to go. But then an unsurprising or a surprising kind of twist came to the story, where the moment our hospital filled up, we actually had an outbreak where 20 nurses were infected by the disease, and we had to shut down 2 entire floors of the hospital. So imagine we had spent all this time preparing for various scenarios, and just when we thought we had the situation under control and everything was kind of going as planned, there was a very unexpected kind of twist. And all of this happened because all the nursing staff on those 2 floors were having lunch in a common lunchroom, or at least that's what we think is how it started. And so suddenly 20 staff were infected. They were put in a 14-day quarantine. Unfortunately, no one had any lasting effects, and no one died as a result of the disease. But it did mean that our hospital, which was already running at full capacity, suddenly lost 2 floors and was now over capacity. So these are just some of the, when we talk about uncertainty, these are just some of the many challenges that every healthcare system is going to be facing. And of course, systems that are able to quickly respond to these challenges are the ones that are going to be able to do well. To give you the counterexample, a lot of the nursing homes in Canada, unfortunately, did not have adequate plans in place and did not have adequate training for their staff. They did not stock up on adequate personal protective equipment. And as a result, the majority of the deaths in Canada have been in nursing homes because there was inadequate planning and inadequate interaction with the provincial and the federal government. One of the many other changes we're going to be seeing moving forward is the spread of e-health. Most of us aren't used to seeing our doctor on the camera over the phone, but that's going to be the new normal. Most of you moving forward are going to at some point interact with your physician via the internet, where you're going to video chat with them, and your prescription is going to be sent home to you via delivery, similar to how you order things on Amazon Prime or how you order things on Flipkart or whatever e-commerce platform you're using. Only your prescriptions will be delivered home to you that way. So that's going to be another huge and perhaps in many ways welcome change. And the other aspect of change we're going to see is a re-energizing of public health systems. In many countries, governments have not spent enough money on that. And we're going to see that there's going to be increased funding of our public health systems, because most governments are going to look and say, hey, this is a very good bang for our buck in terms of value that we're getting. In terms of medicine itself, I think medicine itself is going to change in a really important and exciting way. Most of the research in Western countries and Western research institutions is focused on strokes, heart attacks, cancer, diabetes. Infectious diseases are often pretty low on that list of funding. But with the outbreak of COVID-19, we've seen an increase in funding for virology research and infectious disease research. And I think this is going to lead to some very valuable insights. It's going to help us better understand and cure existing diseases, for example, Bell's palsy or shingles. We're going to have better treatments for these diseases, and it might actually help us discover viral underpinnings of diseases we initially thought were autoimmune. To give you a couple of examples of this, for example, cervical cancer, we have discovered that there are viruses that can predispose or increase your risk for that. Peptic ulcer disease is similarly, previously thought to be purely due to lifestyle, but now we've realized that, H. pylori, a bacterium, can increase your risk for that. So I think with COVID-19 and increased virology research, we're going to find a lot more about diseases we previously thought we understood. But most importantly, I think one of the biggest changes we're going to see is in government. And I want to talk a little bit about this because I think this is so key to COVID-19. Let's look at the response of the Brazilian government. The Brazilian government of President Jair Bolsonaro, where the president has refused to acknowledge COVID-19 as anything more than the little flu. Brazil, unfortunately, has been devastated by the disease because the government has not reacted strongly enough. Brazil has the highest number of new cases as of May 27th, and the second highest number of daily deaths as of May 27th as well. And you compare this Brazil, which is a democracy, to another democracy, for example, like Taiwan. Taiwan, which is right next door to China, has had an amazingly strong handle on the disease. Taiwan responded early on to the reports from Wuhan of a new virus spreading. They started stopping travel from China and doing appropriate contact tracing of people who were coming from China. They started stockpiling on personal protective equipment early on, and they used information technology tools to quickly identify people who were infected and isolate them. And so you realize that, two democracies, Brazil and Taiwan, but they had such different outcomes. And even though Taiwan was right next to China, it was barely touched by the disease, while Brazil, which was on the other side of the world, is being so severely impacted. And it just shows us how important good governance is in a situation like this. And of course, most people in the media, they talk about how the Chinese government did such a great job. But I would say the Chinese government actually fumbled the response from the very beginning. First, the Chinese government, being a dictatorship, tried to suppress any reports of the disease, which is what led the disease to become a global pandemic. Then they went to the other extreme and completely shut down the nation. And as a result, their economy has taken a huge hit. What you realize from a country like Taiwan, which did an appropriate balance, or South Korea, between using technology and other tools to isolate people and to stop the spread of the disease early on versus shutting down the whole economy, you realize that it's actually vibrant democracies that have proper checks and balances and are able to deal with this uncertain environment. They're the ones that are really going to be able to come out of this relatively unscathed. Next slide, please. And I think, of course, there's going to be a huge kind of reevaluation of science and society and the role that science has to play in how we make decisions on a societal level. Let's look at the Canadian versus the American response. So many American states, for example, have chosen to open their borders and go back to business as normal. This has been a huge problem. America has taken the brunt of COVID-19 and is going to continue to do so because they continue to underplay the science behind it. It's more Republican states that are opening their borders, Democrat states that are not. These decisions are not being made based on science, but are being made based on politics. And there's a very real harm associated with this. Now, we in Canada have the same political divisions, perhaps not as extreme as the States, but we definitely have the same political divisions that are there in the States. But in our response has been very different. There are state premiers, the equivalent of a chief minister in India, whether they be conservative or whether they be liberal, whether they be left-wing or whether they be right-wing, have actually gone and let the public health scientists make the decisions. And they have worked well with our public health authorities. The big difference is that on a per capita basis, Canada has less than half the mortality or deaths from COVID-19 and less than half the infection rate. And it's because science is being used to make decisions, not politics. And so I think one of the other big changes we're going to see is that when we're dealing with such an uncertain environment where there's so much changing, the role of science in making decisions on a societal level, I think it's going to be much more prominent. Next slide as well, please. But most of you may be asking, how is COVID-19 going to disrupt my life? I mean, this is a really hard question to answer, but what I would say is that some of you are going to be very personally affected, unfortunately. Some of you are going to be infected yourself, or maybe it might be a loved one or a dear friend. But fortunately, most of us are not going to be directly affected. But we will be affected in the way that society around us is going to change, as it already has. Travel will be different. For example, public transit will have to change in an important manner to actually get people comfortable traveling on trains and buses again. Air travel will have to adjust drastically to have new technological solutions to clean the air in an aircraft. Social isolation, for example, may cause people with depression and anxiety disorders to feel more isolated and stressed. There are going to be increased reports of domestic abuse, which we have already seen in Toronto, with police being called to much more domestic abuse cases than they were ever before. And of course, this is because people are in that same environment. They're not able to leave. They're not able to interact with other people. This is leading to more conflict. And of course, after the pandemic or even during it, we might see a rise in divorces. And on the other hand, we might actually even see a mini baby boom. But there are going to be many changes coming forward, as I'm sure you're already aware of. There might be more of a fear of connecting with strangers. There might be more of a spread of a stay-at-home culture. But I don't think it's all going to be negative. There is going to be, for example, more of a hygiene-focused culture. There is going to be an increased ability to work from home. More companies are going to want to have better sick benefits and paid sick leave to actually hire people. What I'm trying to say is that this is not just going to impact your day-to-day life or your civil liberties. It's going to impact everything from how you interact with people that you meet in a cafe to how you interact with your own family. So the impact of this virus is quite deep. But I think the most long-lasting potential impact of COVID-19 is going to be the potential dehumanizing effect of the virus. As efforts to minimize the in-person interaction continue to be widespread, and these efforts are, of course, aided by social media platforms, we run the very real risk of dehumanizing many interactions that were better conducted in person, that were better just to be person to person, where you can see the other person, you can talk to them, you can hug them, you can interact in other ways. And we're going to see a lot of that kind of go away. And unfortunately, that might be one of the lasting legacies of this pandemic. Next slide as well, please. Or maybe none of this may happen. Maybe we're going to have a great vaccine that's going to be discovered that's not going to require cold storage. So that means it can be easily distributed in even remote areas. And so this would allow us to restore the norm very quickly. What the future holds really, as I said at the beginning, is that there's an incredible amount of uncertainty. And that's really the only thing we really can be certain about. I think we've talked a little bit about the big picture, but I also want to take a brief moment to talk to you about how COVID-19 has kind of changed the way I practice and my colleagues practice medicine. For example, when the pandemic first started, it really changed how I thought about work. It was the first time that I felt a real sense of fear going to work. I'd never felt fear going to work before until this, because there was a real threat of dying from something you got at work, and that was just never there before. And I'm a healthy person. So in spite of that, if I'm exposed to a high viral load from a patient who's coughing, or when I'm about to intubate a patient, when a patient has difficulty breathing, we have to sometimes put a tube down to breathe, to help them breathe for them. During such a procedure, I can be exposed to a high viral load. So in spite of being a healthy person, there's a very real danger of being badly infected and even dying from this. Or taking the virus back to my elderly parents or my family members or neighbors. So COVID-19 really changed the way we practice medicine. In emergency medicine, and I see there's another emergency physician also going to present today. I mean, we have a lot of sick people going through the door, coming through our doors, and our first instinct is to go in and help them. But now we have to stop. We have to stop. We have to put our gear on, and because we just don't know who has the virus. So sometimes, I have to watch helplessly as a sick patient will get sicker, as my entire team has to gown up and get all the equipment ready and in at the same time. And of course, there is a whole kind of jarring effect of seeing a perfectly healthy 25-year-old, needing to be hospitalized because they can't breathe. I mean, these are things we're just not used to on such a regular basis. It's changed the way that me and my colleagues interact with people. So when we go in to see a patient, previously we used to examine them, and I used to pride myself on actually examining every patient. But now I have to keep a 6-foot distance and only examine if I actually absolutely feel the need to. And on top of that, in spite of all our best efforts to prepare for this pandemic, our hospital is full. Our wards are completely full. And as I just spoke about before, our staff have been, significant staff have been infected. And so we have had to adjust to that. So there's a whole new reality and a whole new degree of uncertainty that just wasn't there before, that is there now. So if anything that I would want you to take away from this is that I think the biggest impact of this virus is going to be the uncertainty that it brings with it, and the dehumanization that it might bring with it. And any company, corporation, society, health system that really wants to cope well with this virus has to really learn to adapt very quickly, learn very quickly, and still try to keep as much of that human touch as possible. And that's it for me. Any questions?
Hello, sir. So
Yeah.
we have a question over here.
Sure.
How do we manage COVID till we get a vaccine? We can't have a lockdown for a long time. Is social distancing the only way?
That's an amazing question. And, I don't want to pretend to be an expert in this, but I think there's a fair bit of good examples from other countries that have done a decent job of managing COVID. If you look at, for example, South Korea, where they have kind of built-in social distancing, and Taiwan, where they have built-in social distancing into their retinue of the way they interact. I think that has allowed for them to open their economy. I can speak from my own experience in Toronto, where our government has actually opened or had a partial opening of society and business in general. And what we do is, there's social distancing signs everywhere. It's become a part of our normal conversation. We encourage everyone to wear masks, good hand hygiene. With all of these measures, even though we have opened up a part of our economy for the past several days, we haven't seen a significant rise in infections. And we have also bumped up our testing capacity. So I think to kind of cope with this, you need to have adequate testing capacity. You need, social distancing needs to become part of the regular kind of conversation and social interaction. And everyone needs to take responsibility for this.
Okay, thank you, sir. We have one more question from Professor Umakant. Professor Umakant, kindly ask your question.
Thank you. Thank you, Dr. Vijayata Shetty, madam, who gave me an opportunity to participate in this international webinar. My question is that up till lockdown is, during this lockdown period, how we can gear up our economic condition? This is the big question before all the government and common peoples. This is how we overcome this crisis of economic situation. This is one thing.
That's an excellent question. And I mean, I think it's a really tough question to answer. Sorry, go ahead.
Yeah, you can go.
Oh, no. So, I mean, I think that's a really tough question to answer. I think it's a really good question. I think it's a question that I think everyone from the smartest people from every part of the country or every country in the world are probably thinking that exact same question. And I think every country is going to have a different response, right? So, for example, you look at a country like India that's trying to become a manufacturing powerhouse. I think the question is going to be answered very differently than, for example, a country like Canada, where we are mainly a services-based economy, where we might have an easier time adjusting to this because some of these services can be easily transitioned to an online working environment. But in a manufacturing setting, it might be much harder to do that. So I think this question is a great question. I think it's going to be, a lot of smart people are trying to answer it. And I think it's going to depend a lot based on every country and every even state within a country. For example, Maharashtra might have a very different answer to this question than J&K, than another state that's very dependent on tourism, right? So it really depends on the local economy and what's driving that local economy. So I think this is a very nuanced question that's going to require a very kind of customized answer based on every city, every state, every country is going to have a different answer to that.
Sir, another one, my question is there. Now you are related to the clinical medicine.
Yes.
Now in our India, that homeopathy one medicine is there. That is the arsenic album 30. It enhance the immunity power of the person. And so is it good or is it correct?
I mean, I think this would be something I would be very careful about kind of using a treatment, especially homeopathy in this setting, mainly because, I mean, the way I look at medicine is not Western medicine or Eastern medicine or homeopathy or allopathy or anything like that. The way I look at medicine is medicine either works or it doesn't. And if it works, it's good medicine. And if it doesn't work, it's not good medicine. And I think if anyone is going out there saying that, you want to use arsenic or whatever else they may have as a method of treatment for this, they need to provide evidence for it. So where's the proof? Show me the evidence behind, treating this patient with this homeopathic treatment versus not treating another person with that treatment. So I think if anyone tries to sell you or anyone else any treatment and say that it's effective, I would say, hey, where's the proof? show me the evidence, because I think that's really what needs to drive it. It's not whether, I want to use homeopathy or I use Ayurveda or anything else. I think let's just look at the actual evidence. So, and the same applies to any pharmaceutical company trying to sell you a medication for this.
Okay, thank you.
Sir, we have one more question. Sir, please comment on the role of WHO in controlling this pandemic.
I think the WHO has been, unfortunately, very slow in many ways in reacting to this pandemic. If you look at the response of countries that have been successful in controlling this, for example, again, I go back to Taiwan. Taiwan did not wait on the WHO recommendations before screening travelers from China, before shutting down travel for China, and before doing contact tracing and all these other measures. Canada, on the other hand, actually did wait for the WHO to declare this as a pandemic before it started responding more strongly. And we had a significant outbreak because of the delay in our response. And so I would say that the WHO was very slow and maybe too slow to respond to this. There are going to be many people who are going to have different explanations for why the WHO dragged its feet on this. But I would say that their response was substandard and could definitely have been better. But at the same time, hindsight is 2020. But I would also, again, point to the example of other countries that have successfully controlled the outbreak. And those are the countries that did not actually listen to the WHO recommendations. They took their own measures, they took them early, and they were the ones who were successful.
So can we take one more question?
Of course, yeah.
Okay, so the other question is, COVID-19 has changed our basic perception towards fellow beings. It also raised issues of neoliberalism, where rich have better access to everything and poor have to bear the brunt of every issue. My other question is about losing trust among people, because there is a doubt that COVID-19 is lab-made.
Yes, I mean, I would say that anyone who claims that, again, COVID-19 is lab-made has to provide proof of it. I think, I can claim, for example, that there are unicorns in the world, but you're not going to believe me because, you're going to say, hey, where's the proof? Show me a unicorn. And by the same example, I would say, if someone comes and claims to me that COVID-19 is lab-made, please come and give me the evidence. I think all of us need to learn to just look at hard evidence and not just hearsay, because there's a lot of false information going around. To answer your other question, there was two parts to it. Do you mind repeating the first part again?
COVID-19 has changed our basic perception towards fellow beings. Nice. It also raised issues of neoliberalism, where rich have better access to everything and poor have to bear the brunt of every issue.
Yes, and that's an excellent point. And I would say this is, again, where the role of government, NGOs, where society has to kind of step up, but especially government has to step up, right? If we can't live in a society where, and it's not reasonable for us to tolerate a society where if you're poor, you're much more likely to die of such an easily communicable disease. Versus if you have money, you're much more likely to survive. And that is what we have seen. We've seen that, early and good access to high quality medical care allows you to have a better outcome. And so I think this is a big conversation that needs to happen in India itself, where I know that there's a mix of a public and a private healthcare system. And Indians need to have the conversation about, how are we going to use our hard-earned tax dollars, and how are we going to build a proper public health system so everyone in India is able to have access to a decent quality of medical care? Because, for example, India is a very rich country. India is, to give you an example, is usually the first or second largest buyer of foreign weapons, often spending hundreds of billions of dollars on them. And so Indians need to have the conversation, do we need that fancy new jet fighter, or do we need a new hospital? And that's a conversation that Indians need to have and amongst themselves.
Okay, thank you, sir. So one last question from Dr. Sukriti Bhalla. Sukriti ma'am, kindly ask your question.
Yeah, hi, Dr. Bhalla. I just want to know that what is your basic strategy on triage? Because since you're working in the ER, so being a developed country, you may have something different that you're doing for your triage, which would be helpful for India as well. So what are your recommendations?
I'm sorry, I didn't fully understand your question, Sukriti. In terms of triage, what do you mean?
What follow when a patient first comes to the ER? How do you start your management? Do you suspect each patient to be COVID positive? Is it what you consider at your hospital?
Yes, I mean, so our hospital has taken the policy, and not just our hospital, most of our health system has taken the policy that we have to assume everyone has COVID-19 and that there is community spread of COVID-19. And so every person coming into the hospital has a mask put on them. Every visitor has a mask put on them. They're asked to keep that mask on throughout. There is hand sanitizing stations everywhere. Every patient interaction I have a mask, a face shield, hair cover, and of course, good hand hygiene before and after every patient. And so, of course, we're minimizing, for example, one of the things I talked about is touching the patient so that we minimize the physical exam until it's needed. And so, yeah, definitely. I mean, I would say those are some of the things that we have done that have helped kind of control the spread among our own healthcare workers.
Yeah, thank you.
Yeah, but it really is assuming that everyone has it. I mean, I had a patient, who came in from Mexico who had abdominal pain as her only symptom. And on a CT scan, we found COVID at the base of both lungs. And of course, the COVID test came back positive 3 days later. So, and the only symptom was abdominal pain, no other symptom. So it is really, we have to assume that everyone has it.
Thank you, Doctor, for your response and for that subtle explanation on COVID-19 in the global order. We have YouTube viewers right now, and there's one question from a YouTube participant. May I request Professor Anupama Bali to kindly raise the question?
Good morning, everyone. There is one question from Vishal Shinde. He's asking, what is the difference between coronavirus and COVID-19?
So a good question. Coronavirus is a class of viruses. There's many viruses within coronavirus. For example, your common cold is caused by a coronavirus. COVID-19, also known as SARS-CoV-2, is a very specific type of coronavirus. So it's like there's many different kinds of dogs, and this is a particular breed of dog. I hope that answers the question.
Thank you, Dr. Bharat, for that wonderful session. It was nice interacting with you and clarifying all our doubts. Thank you once again on behalf of Vivek College of Commerce and University of Mumbai.
Thank you for giving me the opportunity to speak as well.
Thank you, sir. We go on to the next panelist. We have with us Dr. Don Campbell, Deputy Director, Trauma Service, Gold Coast University Hospital. He is also a Senior Staff Specialist, Emergency Department, Gold Coast University Hospital. He is also a Senior Lecturer at Griffith University. Sir has achieved fellowship of the Australasian College of Emergency Medicine in the year 1997. He has a long-term association with system development within the region. He has served on multiple committees locally and statewide during time to advocate for the establishment of Level 1 trauma service in the Gold Coast area. Sir was medical lead for the establishment of the trauma service at Gold Coast University Hospital in the year 2014. Doctor maintains an active clinical and leadership role within the service. Sir has a special interest in trauma registry development and application to this for improving quality of patient care. Dr. Campbell is regularly involved in a variety of trauma education activities, including trauma simulation training within the emergency department. His primary research interest is on the use of viscoelastic hemostatic assays in acute trauma resuscitation in the emergency department. Sir has been a co-investigator on a number of other trials. We welcome you, sir, for this international webinar on the overcoming COVID-19 pandemic through nuances of life. Sir is going to talk on patients and patient handle emergency health crisis. Over to you, Dr. Don Campbell.
Thank you so much for that, for the invitation to talk and the introduction, and also to Dr. Bale for his talk. And I'd like to echo some of what he said and share our experience in Australia, which is a little different to what's happened in other countries. So I'm an emergency physician like Dr. Bale, and I see a whole spectrum of disease and trauma. I work in a large hospital, and in Australia, like Dr. Bale, we were very worried about this COVID virus and did a lot of preparation beforehand. We did increased our capacity of the hospital probably 2 or 3 times, the number of ICU beds and ventilators. We stopped all elective surgery for a couple of months, and stopped all leave for all the doctors and nurses, and not much happened. We've been very lucky in Australia, and the reason is, I think, that Australia has acted very early in this crisis. So the Australian government declared a pandemic for coronavirus well before the WHO did, and that put us in a very strong position. The other thing about Australia that's different is we're an island, so it's very easy for us to close our borders with other countries. Our population density is low, and we have a very strong public health system. And I think that has been the key to Australia having such a good control over the coronavirus. And we also have free public hospital for all people. So that has combined to have, in the state I'm in now, we haven't had a COVID positive patient we've had one in the last 2 weeks. There are a few isolated pockets of community outbreak, and we're in the process of our schools reopening. It has come at a big financial cost, there's a big economic impact, and we share the same uncertainties of futures as the rest of the world. So I'd just like to go through a little bit about why this has happened in Australia, and maybe some of the things we've been able to do here may be of benefit to other countries and to India. So I think the 3 pillars of that response has been the strict social distancing, and I'll go through a little bit about how that has worked in Australia in a minute. We have a lot of the education toward personal and community hygiene, and our, as I said, our contact tracing with our public health units, and the community education and engagement. So with social distancing, it's not just a matter of staying apart from people. It's a whole spectrum of things, in fact, that you have to put in place in your society. And the reason is that it's a bit like compound interest. If you can stop the spread of infection of your infection to other people, so if you can keep that spread of infection to less than one other person that you're infecting, the virus, the number of people infected will drop off and the curve gets flattened. If you're infecting 2 or 3 people for each case, then you'll have an exponential rise in the number of cases, obviously. And so what we've been able to do for example, in our institution are things, and I'm sure you're doing the same sort of things in your country, but we've been able to really separate the COVID and non-COVID patients in our institution. So what we do when a patient comes into the hospital, they're all screened on arrival at the door. Anyone that has any sort of symptoms is diverted away from the emergency department if they're well. And we have a fever clinic, a specialised testing fever clinic directly opposite the hospital. Those patients who are sick are diverted to a separate treatment area in the hospital, which has some negative pressure rooms, so we can isolate those patients quite well. And we learnt to flex our system so that can be quite efficient. And again, we've been able to decrease the number of people, say, attending the hospital by using telehealth technologies. For example, we service a lot of patients who live in remote areas. Because we're a tertiary hospital, we might be looking after trauma patients from 200 or 300 kilometres away. So instead of having them come up to the hospital for their outpatient visits, we'll do that by telehealth, which has actually been a huge benefit for the patients. And, you know, in the workplace, it's a matter of trying to encourage people to avoid crowded situations and do a risk assessment of the interaction with other people. So, you know, if you're doing, that includes, a lot of people are working from home, avoiding coming into work, avoiding crowded lifts, and doing their meetings by video and teaching by podcasts and other methods. So we've been able to try and keep our function of our hospitals going by those sort of means. And I think one of the big things we've done in our society is change the culture of coming to work when you're sick. Especially medical people, that's very foreign. We always, you know, our doctors and nurses often work when they're sick, and you know, because they don't want to, you know, by not coming to work, that puts more work on their colleagues. We've turned that around and basically said, if you have any symptoms, a fever, cough, anything, do not come to work, but get tested. And on a larger scale, Australia has been able to quarantine its borders. So a lot of the transmissions in Australia were from cruise ships that came here, and also travellers coming from overseas. So if you come to Australia now, when you fly in, the government has hired out all the large hotels. People are forced to quarantine in those hotels for 2 weeks before they're allowed to come into the country. In fact, they're not letting there are no tourists coming to Australia at the moment, but we have a large number of people who are coming back to our country, but they have to quarantine for 2 weeks if they do that. The public health, if anyone gets sick in those hotels, the public health people go there, they'll test those people, or if they're sick, they'll arrange for them to come up to hospital. And that's a cost, but it's a lot cheaper than having that virus spread in the community, and the impact on the health system. And we've enforced travel bans in Australia. So we were in a complete lockdown, and gradually we are increasing the radius that people are allowed to travel. So when we were locked down here, we weren't allowed to go more than 20 Ks out from our home. It went up to 100 Ks, 150 Ks, and now people are able to travel, I think now about 200 Ks from their home. The reason they do that is obviously to stop the spread between communities. In Australia, we have a lot of remote communities, people who live in small towns with poor medical services. We have indigenous populations who have chronically bad health. And so we are trying to prevent those populations being exposed to the virus, basically. And all the sporting events, cinemas, hotels, where nightclubs, all that sort of thing, restaurants have all been closed down. The restaurants here are starting to open, but they've had to change their business model. So it's been a huge impact economically in Australia on particularly small business. So people who run restaurants, people who run shops, it's the government here has actually been paying people. Australia is a very lucky country economically, but we've been able to pay people to be off work. They have for a limited amount of time, probably till September, and gradually we're starting to open up those shops and people be able to go back to work with changes in their business model. So, for example, where we live with the restaurants, they have a limited amount of seating, but seating within the restaurant, but we'll do a lot more takeaway, home delivery, that sort of thing. So the government has been very good at managing that and trying to have a roadmap for the economy to recover. I would echo the impact on the mental health of our population with these lockdowns, and the socialization, isolation of particularly vulnerable groups like elderly patients, patients with pre-existing depression, drug and alcohol problems. We have seen an increase where I work in domestic violence and trauma related to people being locked down for long periods of time, and family dynamics totally disrupted by this. That's something that worries us, and it needs to be thought about, and we are trying to we're doing a lot of work in that regard to improving mental health services and for those sort of people. But it is really a challenge when people ignore those social distancing rules or don't comply. And I think that's one of the things that people just get sick of being locked down and not being able to do what they normally do and go to work and earn money. And I think that is a big challenge for everyone. So the other things that I wanted to talk about were the approach to personal and community hygiene. So everyone knows about washing hands, and hand wash and soap are good ways to protect yourself, but it's also educating people about the technique of doing that, how to wash your hands properly. Don't just wet them, that you wash them for 20 or 30 seconds, you dry your hands afterwards. And also changing social behaviors like coughing into your elbow, not handshaking, avoiding touching your face and mouth and all those things you normally do just without even thinking about it. We also manage the flows of people and into shopping centres here and the hospital. So what we've done is reduce the number of entry and exit points to our hospital. So instead of having 6 or 7 entrances, we'll only have one entrance. Each of those entrances will have hand wash or sanitizing machines there that people must use on entry and exit to the hospital. And we have someone sitting there making sure that they comply with social distancing and making sure that people actually do wash their hands. The same thing happens here in our shopping centres. In many of the shops that people have to wash their hands before they go in. And I think that and also the regular cleaning of all surfaces. So I think, you know, doing that sort of thing, there's a greater emphasis on regularly cleaning the hospital, and that's been those are the unsung heroes. In fact, the people who clean up the rooms after patients have been in them, they're the unsung heroes of our hospital in many ways, because those people, a terminal clean in a room can take up to 2 hours in some instances, particularly if the patient's had a complex, you know, had a CT scan or something like that. So it's important to remember that. Public health and education has been something that Australia has also done well. So the contact tracing in Australia is excellent. So anyone who tests positive for the virus, our public health will try and contact every person they've contacted. And that is often 70, 80 phone calls per patient that tests positive. All of those people are advised to quarantine themselves or get tested if they get any symptoms. Sorry, to isolate themselves if and to get tested if they have any symptoms. The other thing is that there's in institutions, the public health and infectious disease people get totally overwhelmed by inquiries. There's a myriad of questions that people have about COVID, and we've actually got a roster of someone on to take all inquiries. It's mainly the emergency physicians are taking on that role here, but they take on all COVID-related inquiries for the hospital. So questions about who should get tested, whether patients should be put on, say, high flow oxygen or not. But that sort of thing you should consider maybe for, you know, you should have someone in your university or so you should consider that role of someone who actually is familiar with all the protocols, someone who has the contacts that people can contact if there are questions. And I think for our institution, that has worked really well, and it's been a positive thing. And also having lots of educational resources around, posters around your institution. We've got websites available, both at health level and government level. And also we are implementing in Australia a COVID tracking app, which has had some uptake. It's not, we're aiming to get about 50-60% of people, if possible, having that app. What that does is shares, if you have been in contact with a COVID positive person, public health can actually track other people who you've been in contact with by the phone proximity. So in summary, I think Australia has been extremely fortunate in what's happened with COVID. It hasn't been really the result of having lots of ventilators around. It hasn't been the result of you know, even the emergency. We've had a number of COVID patients come through, but it hasn't overwhelmed our resources. And I think that's how you get better outcomes with your institution. So if you have an overwhelming number of people presenting to your hospital system, it gets totally overwhelmed, and the quality of care for those patients declines. So we've been very lucky that we've been able to control that. And it's really because I in my mind, it's because of the strong public health system that we have here, the ready availability of testing in the community. So testing is widely available and it's free. It doesn't cost people to be tested. And obviously the contact tracing at the back end of that. So that's all I'd like to say at the moment, but I'm very happy to take some questions. Thank you for listening.
Thank you, sir. So we have a question. COVID-19 has changed the perception of doctor-patient relationship. Doctors have become apprehensive. What is your view about it?
Yes, it is indeed something that affects you as a doctor and your relationship with the patient. And as Dr. Bal said, I've never been scared to go to work before this happened, but and the fear of not just getting it for yourself, but bringing it home to your family and loved ones. And so it is something, but I think if what we try and do is do a risk assessment on every patient that we see. So we're fortunate. Unlike Dr. Barr, where the COVID is in the community, we are lucky here that we can risk assess the situation. And I think we're trying to do more a smarter way of interacting with patients. So a lot of our general practitioners are actually using video consultation as an alternative to face-to-face with the patient. But yeah, I think it's going to change all of our relationships with everyone, not just the doctor-patient relationship. I hope that answers your question.
Thank you so much, sir. We have one more question from YouTube participants. As educational institution, how to promote wellness among our students?
Sorry, how to promote? I just missed the question, I'm sorry.
As educational institution, how to promote wellness among our students?
Oh, thank you, sorry. Yeah, so I think the wellness side is about education and trying to prevent the spread. And that's what I was saying about social distancing and good attention to hygiene and just being educated about the symptoms of COVID and not attending if your educational facility if you are sick. So it's not going to be, I think I don't have, there's no other answer really. It's all about prevention. Until if we're fortunate enough to have a vaccine, that will be a great step forward. But at the moment, there's no validated treatment and there's no vaccine. So the smartest thing is trying to prevent the spread. Thank you.
Thank you so much, Dr. Dawn, for that wonderful insight and giving us real scenarios where what an educational institution should be doing right in COVID-19 scenarios post-lockdown. Maybe awareness is the key for all questions, sorry. Thank you so much, Doctor. We are grateful for you having with you.
My pleasure. Thank you.
We move on to our next panelist, Ms. Niyati Dhawale, a counseling psychologist, a crisis and suicide prevention counselor, and a Pranic healing practitioner. Healing is defined as to make or become healthy or whole again, to restore to original purity in mind, body, and soul. Now we have Ms. Niyati Dhawale, who is a registered member of Australian Counselling Association, currently works as a crisis and suicide prevention counselor in Australia. She strives to update her practice through regular professional supervision and professional development activities. She holds a master's degree with specialization in counseling psychology from SNDT University, Mumbai. She has overall 6 years of experience in the field of school counseling and teaching subject of psychology in undergraduate level. Madam has assisted in several research projects and presented research papers at national level seminars and conferences. She has a leadership trait to work with adolescents and family to develop life skills so that they can enable and prevent the urge of crisis and suicide. She has designed through her research mindfulness practices and found an alternate therapy of pranic healing, to name a few. She's a goal setter. Her vision is to incorporate practice of conventional psychotherapies with application of principles of energy science, a modality which is actually known as pranic healing, to enable the clients achieve best results in the process of counseling. She also promotes a mindfulness practice called meditation on twin hearts for peace and illumination. And she has an accomplishment of training hundreds of people under it. Madam is a dedicated, compassionate, and concise mental health professional with interest in culinary skills and a reading enthusiastic. She definitely believes in a Rogerian principle. To quote, "The curious paradox is that when I accept myself just as I am, then I can change," quote unquote. We welcome you, Ms. Niyati Dhawale, for this international webinar. Over to you, Ms. Niyati.
Thank you, Professor Maria. I would like to thank everyone to make this webinar happen. So what I'm going to talk in this webinar today is about an alternate therapy, complementary therapy that I have been using for almost 10 years in the field of psychology. So I'll quickly, so the topic here is going to be more focused on how to manage our own selves, as well as emotionally, physically, as well as psychologically during this pandemic of COVID-19, as well as after the lockdown is open, how and where we can, take it. This thing. So what I'm going to do in this 30 minutes is I'm going to talk about this therapy of pranic healing. I'm going to talk about what prana means. It's a Sanskrit word. What are the principles that are involved in pranic healing? Also, how the pranic healing takes place. What are the laws of nature that it involves, and my personal professional experiences with pranic healing as well as psychotherapy. So the note is that what I want to put forward here is that pranic healing is not intended to replace orthodox medicine or science. Pranic healing can be used as alternative complementary therapy along with field of medicine. Pranic healers do not diagnose or give medicines. It is a completely no-touch, no medicine approach. Pranic healing works on the energy body, which loosely is called as aura. Pranic healing is based on pure research and has been standardized, and it has copyrights to the materials. Okay, next slide, please. All right, so now this is something what is seen as energy body. Pranic healing, the word prana is a Sanskrit word. It translates into life force or energy. It is, in a scientific term, what the energy body is called is bioplasmic body. In the picture, you will see there are two sides here. One is called healthy aura, one is called dirty aura. Dirty is a very layman term. Mostly in pranic healing, we call it as diseased energy. Okay. Now, disease is formed at different levels. It can be physical, it is etheric, also emotional and psychological in nature. Now, what pranic healing does here is that it tries to clean this aura, clean this energy body, and it tries to maintain the balance of this energy body. Energy body is actually worked as a shield to the physical body. Now, when I say this energy body, there are, especially in Indian tradition and many other religions, cultures, the energy word is quite prevalent. Pranic healing is not related to any religious beliefs or any religion particularly. It is comprehensive therapy. So this energy is something that is always all prevalent. Okay. In Indian, because most of the participants, what I see, has a little bit of knowledge of Indian culture, you would see the grandmothers or mothers or, taking salt in hand and moving around your body whenever somebody comes home from a day's work or a travel. That was science. That is science. Okay, we will come to that, what could be the purpose of it. So yes, so pranic healing is based on energy body and energy, balancing the energy. Next slide, please. When this energy body is affected because of any kind of influences from outside. Now, in this picture, you will see there are a lot of drawings. It looks like drawings, but these are actually, when looked clairvoyantly, they are called thought forms and a lot of emotions in our aura. At times, you'll see it's quite chaotic at times. Our energy body, it acts like a sponge. It absorbs whatever is there in the environment, right? And physically, if you get to see the infections, is something that, yes, you can get contaminated. This contamination is not all the time on physical level, but this contamination can be at emotional level also. So what we are experiencing right now in this pandemic, there is not only 10 people or 12 people or thousands of people who are experiencing fear, but this fear, this worry, this exhaustion, it is at very much global level. Okay, so next slide, please. This aura or energy body, how is it scientific? Okay, now the Kirlian photography is something that you can always look up. This person, Simon Kirlian, when he was a physicist, so when he was doing some research, he found through this Kirlian equipment that there is some kind of discharge, gaseous discharge happening around physical body of a human being. So he then went more into the experimentation and all of that. So there's something called GDV camera also. It is a tool, a present physical tool with which you can actually see your aura by your naked eyes. For a normal person, ordinary person, it is not possible to actually look at this aura without these instruments, because this aura is made of fourth subject matter, which is bioplasma, therefore the name bioplasmic body. This bioplasma is not something that you find in your body in liquid form or anything, but this is in the form of ether, which is the fourth matter of subject. Yes, so if you will see in this picture, whenever there is a disease present in the physical body, you will see the aura of a person, the energy body of a person is also affected. So this energy body and physical body, they are interconnected. Okay, if you get any physical harm, the energy body around that portion is going to get affected. When there is some kind of disturbance in your energy body, your physical body is going to get affected. I'll give you a very simple example, which is most of us must have experienced at some point of time in our life, is that whenever you suspect that you're going to get a fever, okay, sometimes your body gives you signal. Your throat gets itchy, or at times you physically feel very weak. Okay, so if you use this photography or GDV cameras, you will see your energy body is disturbed. There is a lot of uneven presentation on the energy body. That is something called disease energy. Okay, it could be anything. It could be any infectious energy. It could be any kind of stress. Stress is also, by the way, an energy. Okay, so this is formed around our aura. And then if you do not take any precaution for that, if you don't take any medicine, or if you just do not relax yourself, this disease energy enters into your physical body and it affects the physical organs. Okay, and then what is seen in a thermometer is your temperature rise. When now we will move a little bit towards how pranic healing works in this scenario. Pranic healing, next slide please. Pranic healing is based on two scientific principles, which are called cleansing and energizing. Okay, cleansing of the disease energy, cleansing of the stress. Yes, thank you. Cleansing of the stress, cleansing of the disease energy. In the picture, you will see the energy body is getting cleansed by a pranic healer. Now, let me talk a little bit about how the pranic healing session goes. Pranic healing is like I said, no-touch therapy. What a pranic healer does is, without touching the physical body, we are working on the energy body of a person with just your hands. You do not need any equipment. You do not need any camera or any machinery, any tools for that. Now, using your hands have been, in the ancient times, it has been very common occurrence. I'll give you a few examples. You must have heard stories of a great saint called Sai Baba. What he did, he would just move a hand over a patient's physical body, at times not even touching, but the patient would get relieved of that pain, relieved of that disease. And you must have heard a lot of stories of miraculous healings. A patient who would not be able to walk is able to walk now just by move of a hand. Even in Christian religion, Lord Christ is known to perform many such miraculous healings. Now, when we talk about this, it's at times it sounds very vague, because we are not aware, yet till now we were not aware of this energy science. What they did was exactly what you see here, a pranic healer doing. What they did was removing of disease energy and then energizing it with a fresh prana, with a fresh energy. Now, when I say energizing, how does that happen? Energizing, I'll give you a few simple example. When a person is going through depression, usually the person is asked, is recommended to take a walk on grass, or be in nature as much as he or she can. Why? What is the reason for that? Because nature has a lot of fresh prana through the trees, through the earth. earth prana, there is sun prana. Many a times, we are, as a human beings, many a times to get the calcium D, we are expected to stand in sun and soak in the sun. Not too much though. So what is that? That is all. Nature has a lot of fresh prana, fresh pranic energy. So what we do in a pranic healing session is exactly that. We are cleansing the part, whatever part needs healing, and we are projecting, we are transferring a relatively clean, fresh prana. Now, a pranic healer does not use his or her own energy. The pranic healer is taught to use energy that is surrounding him or her. Okay, that is a technique. It's a very, very good technique. Therefore, the beautiful part in pranic healing is the contamination level for each other, for the patient or for the healer, is quite minimal. It is being taken care of. That is the way pranic healing has. So these are the very, very basic principles of pranic healing. When the fresh prana is circulated throughout the energy body, throughout the aura, the physical body also reciprocates. Okay. Now, how does this happen? This energy transference happens through something called chakras or energy centers, which are located on this aura, on this energy body. These chakras, or if you are aware of something called meridians, nadis, which are called, so when these chakras, when these meridians are cleansed, when they are relatively healthy, they are like straws in our body. They are like a plumbing system in our body. They move and they circulate the prana throughout our body. When that is happening, your physical body is also reciprocating to that, and it is keeping it alive. I will give you an example here. Now we are talking a lot about this energy, this fresh prana and all of that, okay? Here is something that I need, I want you to think. When you get a cut on your finger, or when you are maybe shaving, you get a cut, do we run to doctor for stitches? No. If it is a very minimal surface cut, okay, what most of the time we do, either we put a bandage, we run it under the water, or we put just a little bit of turmeric, whatever we have. After 2 days, if you'll see, your skin is healed. Have you ever wondered how that happened? Yes, the body helped the cells to get healed and get regenerated. But have you ever wondered how would cells know to regenerate at that particular point, right? How is brain working? How is the phenomena going? How does the brain know that this is happening? And how does brain is giving instruction to heal the body? So the cells has consciousness. The consciousness is energy, and it is everywhere. The energy is everywhere. So as long, the other example I would like to give is aging process, right? It is very natural to age, right? If there is a disease, okay, for example, if a small boy, say 8 years old, if he gets a fracture on his hand, and if a 80-year-old gentleman gets a fracture on his hand, what do you think? Who's gonna heal? Whose body is gonna heal faster? Obviously, the body of a small boy is going to get healed faster, because that is, next slide please, because that is the law of nature. Okay, next slide. Yeah, so this is the law of nature, law of energy, law of self-recovery, right? The body has the capacity to heal itself. That is the law of self-recovery. The more previous slide please. Yeah, so the law of energy is the same law of energy, that the more energy you will have inside and outside on your aura, the more aging is going to be slower, slower for you, the more work is going to get done by you. When pranic healing is applied, so pranic healing as a science is used for these two particular purposes. Whenever, for example, I work as a mental health counselor, especially for crisis intervention. So whatever the call I'm going to get, I know the person is under crisis. Emotionally, mentally, the person is exhausted. Physical exhaustion is also experienced at such times. We all go through that at some point of our life. Whenever we are thinking too much, the too much thinking is experienced physically also. So being a psychologist, I have to have that understanding of mind and body working. How is that working? So when I am trying to provide my service of counseling to all of them, there is an energy transference always happening. It is same with everyone. As a professor, as a teacher, when you're talking to your students, of course, you're experiencing that energy transference. When, as a doctor, when you're interacting with your patient, there is always energy transference. I remember one of my doctor friend, he's telling me many a times patients feel better just by talking to a doctor. What happens there? There is an energy transference that's happening. All right. So as a pranic healer, what I do, when a lot of energy is spent on, during interactions and all of that, I come home, I apply pranic healing just using my hands. I balance my energy body and my energy is restored. I feel more fresh than what I felt earlier. Okay, next slide, please. The other important and very interesting technique that I learned in pranic healing, and anybody can learn, anyone who is 16 years and above of age can learn this technique called meditation on twin hearts for peace and illumination. Now, look, meditation is something, yes, we always think that it is closing your eyes and just sitting. So it is not like that. The other important and very interesting technique that I learned in pranic healing, and yeah, thank you. So this meditation on twin hearts, if you will see here, the something on top of the head is a chakra called crown chakra. Okay, and what you see coming out of the hand is energy. Okay, and we are blessing the earth here. Okay, pranic healing, meditation on twin hearts is practiced all over the globe now, almost about 130 and above countries. Many thousands and thousands of people are using twin hearts meditation to heal Mother Earth, to change the energy of Mother Earth. Okay, Mother Earth being a conscious planet, it has energy body just like a human being has. Okay, when you're blessing the earth, what's happening to you is also you are getting a lot of this divine energy, a lot of this fresh energy, and you are getting healed in the process. All right. What you see here on this slide is a representation of your aura. You can't see it from your bare eyes, but yes, if you use certain tools, certain machines like GDV and Curlian, you will be able to see that. However, the purpose is, what are you going to do after that? So pranic healing tells you to do what you can do with this energy. Now, it is a great platform to really talk about energy, because what we are experiencing right now in this pandemic is mainly what we see, the physical symptoms and physical signs. But I need you to think about what it has done to people psychologically, mentally also. Okay, it has made people think, it has made people sit in their home and really kind of look inwards at times. Energy is something that can be used. It's a very precious knowledge, because it is very rapid. Okay, it's very, very simple. It is like you're pushing a heavy load somewhere, but if somebody comes and helps you to do that, it is quite quicker, right? That is something what energy healing or any energy science does to the medical field, to the medical science. It is a complementary therapy for everyone, it is used right from infants to the aged population. Okay, now it's very important to understand why this meditation. I'm speaking about why this meditation. The chakras which I mentioned, the energy centers which I mentioned, they at certain level connect to your physical organs, and also they kind of make the physical organs work. In Twin Hearts meditation, we focus on heart chakra, anahat chakra, which is called in Sanskrit, in yoga also. This heart chakra is chakra controls to a certain extent thymus gland. Now, if you all know thymus gland, yes, we all know that thymus gland is a plays major part in immune system, in strengthening your immune system. What does this meditation does is it activates your heart, and when the heart is activated, your immune system is getting stronger and strengthened. All right, next slide, please. Okay, so let's come to the very the basic crux of this presentation is what we can do during and after COVID-19 pandemic. It is very important to keep our energy body clean. What you can do, you can always get in touch with the pranic healers in your area. The second is practice of meditation on Twin Hearts. Look at this meditation twin hearts, you can find it online as well, or you can get in touch with me. I can provide you with whatever references you need whenever you need to learn. It is just a 21 minutes meditation that's done. Third is salt water bath. Like I said, salt is something that is observed to be observed as a very important element in absorbing the stress energy from your aura and from your body. So regular salt water baths can be taken, to keep your physical as well as your energy body very, very clean. Basic exercise and healthy food is something that we all hear about and we all try to follow, but that definitely keeps your energy body healthy. Always remember, if your energy body is not balanced or not healthy, your physical body struggles as well. Okay, and it is vice versa as well. If your physical body is not healthy, your energy body struggles to balance itself and work for you. Last, fifth point that is very, very important: generating good thoughts and loving emotions. When you produce these loving emotions, calmness, when you produce happy thoughts, or say positive thoughts, keeping that hope, it kind of, to a certain extent, activates your heart chakra. And remember, when your heart chakra is activated, your immune system is really working to best. Just to give an example, when two people are really in love, is the very, very basic phase of love, you will see they are glowing, their face glows, their skin glows, they are at peak of their good health. What is that? That is an observation. That is the loving energy in your aura that's keeping all your bodily functions perfect. And the last one that I have suggested is some psychological guidance. Look, yes, because of the very constricted time, I can't really tell a little bit of importance of this, but I emphasize reaching out to counselors, to psychologists, take some psychological guidance, because it is a stressful period for all of us. It is changing us to a various levels, emotionally, mentally as well. Something I'm gonna leave you with here is that we need to understand the purpose of this disease, of this pandemic, not only physically, but also mentally, emotionally, spiritually, your growth, okay? When you come out of this, are you going to be a good person? When you come out of this pandemic, what are you doing? What are your thoughts? What are your emotions towards others? I remember one speaker, I think Dr. Bharat, expressing the dehumanization. That is very much real. That's a very much real threat to the entire society. A human being a social animal, it's going to be a very tough task. But that is what the challenge is, that is what the struggle is right now. And pranic healing is something that balances, your physical as well as your psychological being. Okay. The next slide, I have given a lot of references. The first link is very important. A lot of research has been done in pranic healing. You can always Google about the pranic healing research. World Pranic Healing is an institution where the certification, everything comes. Yeah, and the last slide, I have my number and my email ID. Please get in touch with me with any questions you have. I hope I haven't exceeded my time. Any questions you have, I'm open to answer.
Thank you so much, ma'am. We have one question over here. How pranic healing can help us in this present pandemic situation?
Okay, so can you go to the slide where I have given some solutions? Yeah, that's right. So right now I'm a pranic healer and a psychologist talking. So as a regular pranic healing practitioner, I regularly apply pranic healing on myself. I apply pranic healing on others as well to keep their energy body fit. Look, understanding energy, how energy works is a very smart move, because physical body has limitations. Medical field also has limitations. There are these limitations, but when you combine energy science into this, you are much more empowered. I remember one person telling me that once you learn pranic healing, you are no more helpless. Okay, and helpless is something that we all are feeling currently. Okay, you practice pranic healing on yourself, you can do it on others as well. Okay, that's very, very safe. Does that answer your question?
Okay, thank you so much, ma'am. We have one more question. How can one handle teenager distractions?
Teenager distractions, what kind of distractions? Okay, teenager distractions, I'm assuming it is related to some video games or some social media probably. Yeah, that's very, very, very important question. It's a very grave question, to be honest. What you can do, I have noticed that teenagers are quite conscious and quite aware these days of what they're doing. Providing them with something, some information about energy is going to definitely help. The second thing is the meditation on twin hearts. It teaches you a technique of blessing your loved ones, blessing the earth, that whenever the energy changes, things change, things transform. If you will see the small children these days, they kind of dominate parents. The one secret that is revealed in pranic healing is that many a times these children have bigger energy aura, they have bigger chakras than their parents. When parents learn pranic healing and they are able to increase their energy body, they can really work with the children best. All right. That is something I'm going to leave you with. You can discuss with me this on this topic, you can get in touch with me via email if you want.
Ma'am, continuation of the same question. It is regarding the distraction towards opposite gender.
Sorry, distractions towards opposite gender. I really don't get that question. I'm really sorry.
Okay, we take up the another question.
Yes,
respected
please.
madam, pranic healing, how effective it is in COVID-19 in Indian scenario during lockdown?
Yeah, very, very good question. Pranic healing is effective everywhere in the world. In fact, if you could get in touch with any pranic healing center in your area, I have a lot of my colleagues applying pranic healing on patients with COVID-19. There is a study, there is a research done in Manila, Philippines, Manila, where pranic healing is used by many healers on COVID-19 patients. There were around 30 or 60 patients, and they have got 100% results in recovery of pranic healing. So yes, pranic healing is quite very, very effective. Look, at times maybe full recovery is not possible, but because of the physical condition also of a patient, if the patient's body is say age 90 years old, it is very difficult because the condition of the energy bodies are already not good. But the patient can be relieved of pain, emotional suffering also. Pranic healing is used on physical, psychological, mental levels, at every level.
Okay, thank you, ma'am.
Yep.
One last question. Can we learn pranic healing from YouTube?
Pranic healing, you cannot learn from YouTube. You need to get in touch with a certified trainer for that. It's a 2 days course, proper course. You're given a certificate which is internationally recognized. So it's a training. It's a proper training that's given to each one of us into pranic healing. So you need to get in touch with the Pranic Healing Center to learn this course. You need to register for this course. You can watch videos of pranic healing on YouTube. There are plenty of videos on YouTube. You can watch that. Any other question?
Good morning, ma'am. One is from YouTube also.
Okay.
If somebody is getting a negative thought, how can we control this?
Wow, that's that's a very good question. Look, you need to understand what is the purpose of that negative thought, okay, that's coming to you. All right. The point is not in controlling, but regulating your thoughts. If you are getting a negative thought, you need to really go very much deeper into it. But like as a psychologist, like I say, if the negative thought is really changing your routine, if it is affecting your daily life, your relationships with others, you need to find a psychological help from a psychologist or a counselor at that time. Okay. Practice meditation on twin hearts. That helps a lot in removing a lot of negative thoughts. Many a times negative thoughts are not ours, they are projected to cleanse energetically also these negative thoughts.
Thank you so much. Thank you so much, madam, for that wonderful session, for helping us to peep into our inner self through pranic healing. It was wonderful to have you with us for this webinar. Thank you once again.
Well, thank you. Thank you for this opportunity.
Now we move ahead to our next panelist, Dr. Sukriti Bhalla, Associate Consultant, Department of Cardiology, Akash Healthcare Super Speciality Hospital, Dwarka, New Delhi. Madam has several feathers and achievements to her cap. Presently doing a research on the title survey to collect voice samples of patients and age-matched healthy individuals. Madam has been keen on delivering lectures on various transitions, trial ARNI at Akash Healthcare Super Specialty Hospital. She's been conducting several regular cardiac camps on behalf of the hospital, participated in workshop on ethical issues in global health research at Harvard School. She's also working as a sub-investigator in a drug trial on unstable anginal TB trial under the able guidance of Dr. R.N. Kalra, Medical Director and owner of Karla Hospital, Delhi. Participated in observership program at Carlton Memorial Hospital. She has co-authored many papers. Participated again in a drug trial on atrial fibrillation under the able guidance of Dr. G.G. Mansharamani, formerly Director, Professor and Head of Department of Medicine. She has written many theses and research papers and published many under many international and national conferences. She joined University of Medicine and Pharmacy Victor Babes, Timisoara, Romania in October 1999 for an exchange program of 6 years. And it is highly appreciative that in all her tenure of 6 years, she has been the first 10 percentile in her class. And it is rightly said, let your heart guide, it whispers, so listen closely. One can close eyes to the things one don't want to see, but one can't close one's heart to the things one don't want to feel. Over to Dr. Sukriti Balla for having a talk on COVID and heart health, a cardiologist perspective. We welcome you, Dr. Sukriti, once again among us. Over to you, madam.
Thank you so much for your kind introduction and all the organizers for bringing me to this esteemed gathering today. And I hope I'm able to shower some light on COVID-19, the pandemic, is cardiology prospect. And justifying the theme for today's discussion. So, Vivek, hello.
Yes, ma'am, you are audible.
Hello. Yeah, thank you. To the everyday section of the society, the virus has been the rapid spread and the large preparedness for such a mass catastrophe. So it is all healthcare workers and researchers and have and medical. Hello, can you change the slide? Yeah. So COVID-19, as we know, is a coronavirus. It's a common virus which affects the upper respiratory tract, the nose, the sinuses, and the upper throat. It started in the early December 2019. Started in China. We all know about it. It is the SARS-CoV-2, a new type of coronavirus, and the outbreak has spread around very quickly. So based on the current observed disease pattern, a lot of cardiovascular specialists are actively engaged in the care of the patients with COVID-19. The infection has been has a direct effect on the cardiovascular disease, and anybody who has a pre-existing cardiovascular comorbidity. So most important of these, with cardiovascular disease, who are infected with the virus have an elevated risk of adverse outcomes, and the infection itself, as it is associated with a lot of complications. So my presentation is going to be around the COVID-19, its impact on the heart, and how we can look forward in improving the outcomes of the disease. Can we go to the next slide? Yeah. I think the previous one we missed, so. Okay, anyways, this is, yeah, COVID-19, I told you, starts with the upper respiratory tract through person-to-person contact, and the infections range from mild to deadly diseases. So this is what is a lot of anxiety and all of us. Impact. Move forward, please. The next slide. So this is a pictorial diagram of the signs that can be of the virus. It impacts all the systems of the body, to start with the brain, cough, dry cough, mainly the nose, sense of smell, as Dr. told that.
Sukriti ma'am, sorry to interrupt. Your voice is not audible. Sorry to interrupt, ma'am, but your voice is not audible.
Hello. Can you hear me? Am I audible?
Much better, ma'am. Much better.
Okay. So are we on to the next slide already? Okay. So, I will just talk about the main symptoms, which include fever, coughing, shortness of breath, any kind of trouble in breathing, fatigue, chills, body aches, headaches, sore throat, loss of smell, taste, nausea and diarrhea. But all of these symptoms do not happen in the same person. They are varied symptoms. Everybody can have a different presentation to the disease. Move on to the next slide, please. Okay. So what does it ultimately lead to? The virus has extreme impact on a patient. It can lead to pneumonias, respiratory failures, septic shocks, and death. All this is due to the hyperactivation of the immune system of the body. There is a cytokine rush in the body to prevent the disease progression. The immune system acts rapidly, and eventually it can disrupt all the organ functions and lead to these extreme complications in a rapid phase. So this is what is worrying all the doctors, all the physicians, how to tackle these conditions. So the alarming, why do we need to get alarmed? If you see somebody who is a loved one and it back rapidly. If you see anybody with fever and is not awake fully, any discoloration of the lips, all these are signs which show that you need to consult a physician or go to a doctor or seek medical advice. So I would suggest that keep in mind all these alarming features so that you can help prevent and get better medical care for your loved one. Next slide, please. So why I am putting forward this slide, because maximum research which has been going on, we have a lot of data from China, where most of the common symptoms among people who had COVID-19 was fever, which was seen in 99% of patients, fatigue, which was 70%, cough, lack of appetite and body ache, shortness of breath to 31%, and then some people have mucus secretions excessively than the others. So fever is the foremost indication, as per now what we know, that it is a major symptom. It is a major symptom. I am speaking on the headphone now. Hello, am I audible enough?
Yes, ma'am,
Yes,
you are
ma'am.
audible.
Okay, thank you. Some people who are hospitalized for COVID-19, so this is where cardiology comes into place. Some people who are hospitalized for COVID-19 also have a tendency in forming dangerous blood clots. This could be clots anywhere in the legs, the lungs, or the arteries. So that is how the cardiovascular system gets involved, and a lot of autopsies done on patients in Italy, as we are reading, blood clots in people who had this disease and who were unfortunate and could not survive. So that is how the cardiovascular system, the cardiologists have come in, scant in the knowledge, but yes, we can see that people with comorbidities for heart disease are prone to worse complications of COVID-19. So there is prone to increased cardiovascular complication is the message. The next slide, please. Next slide, yeah. Who are the people who are at a risk? People above the age of 65. We all know that elderly populations, people who are living in nursing homes or in long-term care facilities, who have weakened immune systems or who have medical conditions including high blood pressure, heart disease, lung disease, asthma, anybody who's on dialysis, obese, diabetic patients, people on chemotherapy, liver disease, and people who a lot of secrets. And out of all these risk factors, if you see that blood pressure, diabetes, obesity, all these in a person. So anybody with a metabolic disease is partly a cardiovascular patient. So all of the impact from COVID-19 on the cardiovascular system. Next slide. Next slide, please.
Dr. Sukriti?
Hello? Hello, am I audible? Hello?
Yeah, ma'am, you're audible, right?
Okay, so my system is not working. I'm on my phone now, so I think I'll be giving a better reception. So if I'm audible, I'll go ahead with the further presentation. Is it?
Yeah, ma'am, go ahead. Go ahead, ma'am, please.
Okay. So we will discuss the cardiovascular risk factors, prior cardiovascular disease, the immune activation, the threat for shock, any metabolic problems, increased coagulopathy, and patients who are more immobile or elderly. All of these are risk factors for cardiovascular complications. That is, you can have arrhythmias, which is disturbances in your heart rhythm. You could have myocarditis. Any viral conditions. A lot of people are prone to myocarditis, which is the inflammation of the cardiac muscles.
which leads to increased symptoms of heart failure, acute coronary syndromes that include any kind of anginas or heart attacks. Because of increased coagulation, coagulopathy, people are more prone for acute coronary syndromes. There is venous thromboembolism, which is the thickening of blood in the lower limbs, which can lead to clots in your, the lungs can have clots, and eventually all of these conditions are more prone to developing cardiogenic shocks and heart failure. So we need to keep in mind, because this is very rapid. Move forward, please. So now the challenges in cardiology, these are all based on whatever data we have, whatever the scanned data we have been able to gather, the impact of COVID-19 on the cardiological aspect. The challenges in cardiology are COVID-19 and the pre-existing cardiovascular disease, as I've already discussed. There are multiple direct and indirect cardiovascular complications. I told you about myocarditis and the arrhythmias and the thromboembolism. The therapies that are under investigation for COVID-19 may have a lot of cardiovascular side effects. The response of COVID-19 can compromise the rapid triage of the non-COVID-19 patients with cardiovascular conditions. And finally, the provision of cardiovascular care may place healthcare workers in a position of vulnerability as they become hosts or vectors of the virus transmission. So it's a major challenge ahead of us, as a cardiologist, and even for the patient population that we cater to. Next slide, please. So again, the highlights are pre-existing cardiovascular disease appear to have worse outcomes. This is for everybody, patients, healthcare workers, and the health system. In totality, even as a cardiologist, I am at risk of developing the disease, so I don't want to be an asymptomatic carrier for my patient. So cardiovascular complications, anybody who's admitted to the hospital facility, they may not be admitted with the cardiovascular complication, but a lot of patients admitted, they have been seen that a lot of biomarker elevation, signs of myocarditis, symptoms of heart failure, the clotting problems, the venous thromboembolism, which may be exacerbated by delays in care. And therapies under investigation, I'll be talking about it briefly, the drug-drug interaction with the cardiovascular medication. If the patient is already on any medication, how difficult it would be to give more medications which are under trial. And also the healthcare workers and the health system should take measures to ensure safety while providing high quality of care for COVID-19 patients. They are more vulnerable, and it basically leads to a consumption coagulopathy kind of a state where the immune system is overactivated, the clotting is increased, and patient may actually flare up. The condition may flare up, and patient may may not be able to survive all these rapid complications of the disease. So all the drug therapies, which we've been reading a lot about the interactions, and a lot of drug therapy has been tried and tested on people from the ICMR, the Indian guidelines, use of anti-malarial drugs, the antiviral drug, the remdesivir, we are talking about its treatment. It has been used in case of Ebola previously, but it has been noticed from previous trials that antiviral therapy, some of it can lead to hypertension. Some of the antiviral therapy mixed with statins, the anti-cholesterol medication which cardiovascular patients already are on, may lead to increased myopathy, increased tendency to renal failures, and it sets in another cycle. So using all the drugs is not feasible for all these patients who are at risk. So the anti-malarial drugs, we have seen, they're cardiotoxic. A lot of people have rhythm disturbances, and so they have to be monitored carefully. They need more care once used. So people are using steroids. Steroids, they cause electrolyte disturbances, which further promotes greater risk to any cardiac patient. Because any imbalance in the body for the electrolytes, impacts the rhythm of the heart, uh, tendency to increase blood pressure, increased tendencies to heart failure. And finally, the patient debilitation from severe COVID-19 may pose challenges in administering routine cardiovascular medicines, including the range of antiplatelets like ecosprin and clopidogrel. A lot of patients are on blood thinners, uh, beta blockers, which are antihypertensive drugs. Um, Treatment for heart failure becomes riskier. So there could be further clinical deterioration even with medications which are meant to be treating the COVID-19 patients with cardiovascular risk. So we need to be careful using these medications. Next slide, please. A lot of people, a lot of papers were publishing that ACE inhibitors, in layman term, I would tell these are drugs for antihypertensive drugs. The mechanism that was found of the entry of the virus was the ACE2 receptors in the body, which is in the lungs. But whatever data we gathered, the study showed that ACE inhibitors or ARBs, like a lot of people use telmisartan. In India, they are known as Telma or olmesartan. These they haven't shown any adverse effects on patients with COVID-19, and people can use it. They shouldn't stop just taking their prescribed medications just by reading something on the web, or you should consult your doctor before you decide what kind of medication you actually need during this period. Next slide. So the major issue that we're talking about is the prospective. How we should look to it. Is it the new normal, or do we call it the COVID era, or what are our expectations? Are we going to live with this, or is there going to be a post COVID era? So what are our expectations, and how are we going to tackle this problem from a medical point of view? Can we move forward? Yeah. So, heart disease, I agree that it has worse prognosis. Patients come to mortality, deaths are higher. All of this is causing a lot of anxiety in people with any section of community. And we are seeing a lot of problem with younger patients in India as well, because the coronavirus effect is causing a lot of stress. Stress is directly proportional to the amplification in heart disease. So it is a whole package. There is a fear of quarantine, it being fatal, fear of transferring to your loved ones, the effect in elderly, hospital admissions, the monetary burden it brings along with it. We have discussed some of these aspects with the previous speakers also. Work from home, being away from dear and near ones, in case you contact it, you have to be in isolation, even if you're asymptomatic isolation. For students, what kind of stress students are having, not able to go out, not able to meet your friends, not able to travel. Cardiac patients or any patients, there's a lot of neglect of care, fear of going to the hospitals, the lockdown, all these are, this has changed the society completely. So there is a lot of stress right now that we are facing with the disease, and it's going to increase the impact on heart disease. Can we move forward? Yeah. Uh, so some, so what kind of stress do we actually have? There is physical stress, mental, emotional, and behavioral. Uh, we have heard Dr. Neti very good on Pranic relaxation techniques, and I agree. It is very important for de-stressing your oneself. Physical stress. You may just think about muscle exhaustion, difficulty sleeping. Everything has changed. There is constant worry, difficulty making decisions, inability to concentrate. There will be emotional liabilities. Some people are losing their jobs. That's causing a lot of stress. There is a lot of anger, and there are a lot of behavioral changes also. So in totality, all of these stressful conditions, we need to tackle them both medically and with all the healing on whatever we can do together as a society to help each other. coming over these stresses to prevent the complications that it can have on a patient. Move forward. So, what is cardiac stress? Neglect of a patient, patients who are unable to reach the doctor, not being able to update their medication for past few months. Since we are in a lockdown, there's a lot of monetary burden. People are avoiding hospital situations. Uh, it's, like in my hospital, I've seen patients coming with there are newer admissions, but there is a fall in the number of patients with previous heart disease who are unable to follow up with doctors. Uh, Either there is a scare of visiting a doctor, contacting the disease, or any kind of monetary burden. People are unable to go and get proper care, and there are a lot of new hospital protocols for patient care. There is more money expenditure. There is a lot of, we are not, we directly cannot touch the patient. We need to be covered in PPEs. It's a whole drill. This is a new way of dealing with patients at the hospital, both for the patient and both for the doctor as well. So a lot of unwanted stress we are facing. We have to wear a mask. This is the new normal. How normal is this to wear a mask? We have never thought of wearing a mask all our life. So this is causing stress, and it is totally unwanted to have such kind of stress. These are avoidable. There are 5 stages of any kind of catastrophe or disaster that people go through in that is first you are in denial, then acceptance, and then bargaining. So it's better not to deny, better learn to accept what we are going through, and we would be able to cope up with it in a better way. So these are all unwanted stresses. This is on a lighter note. The next slide. A lot of teachers are under stress. The online classes, this is because I'm in a platform where a lot of teachers and students are also watching this webinar. So these are all the kind of stress. The teacher is studying more than the child who's actually doing it online. So I think we should not stress, and accept and learn to do the new normal for the time being, until we are able to tackle the situation. So does stress affect everybody in the same way? No, people respond to stress in different ways to the event and situations. One person may find an event joyful and other gratifying, but another person may find the same event miserable and frustrating. So we need to have a positive attitude. Next slide. So what is the mantra? Lifestyle modification, and yes, it has always been the normal. It is the new normal, and lifestyle modification, we didn't have to force it on anybody. This was always a part of prevention in cardiology. Lifestyle modification holds the first position in any kind of prevention that has to be done in regards to your cardiac care. So let it be the new normal and accept it as it comes. Next slide. So what do we do? How do we modify our lifestyle? We have to eat and drink sensibly, increase intake of fruits, less salt, avoid fatty foods, stop smoking, you do exercise regularly, you can do yoga, you can aim to lose weight, learn to meditate, take responsibility, share your work, be realistic in your goals, have a good night's sleep, and prevent yourself from indulging into late night screen time. All of these, they have an impact on the on your blood pressure, your diabetes. So this is a pictorial description of what I've just spoken about. Just be healthy, be calm, and we'll all cope up with the situation, and we'll get out of it soon. Next slide. So the cardiology perspective is that all cardiac patients, need to take extra prevention. There may not be more mortality, but the cardiac patients are at greater risk for complications. There is more awareness required amongst patient population. All the elderlies in your house or anybody who's on medications need to titrate their medications on time. There should be prompt hospitalization, more teleconsultations to prevent hospital exposures for patients and the doctors as well, maintain healthy lifestyle, proper medication titration, as I told. Do not avoid urgent procedures like coronary angiograms. If necessary, if it is an acute emergency, we need to deal it with prevention, but do not avoid it because it can have fatal complications. And yes, I agree that any planned procedure as a cardiologist is not advisable at present, but whatever needs to be done, please consult your respective physicians and do not titrate any kind of medications on your own. And this is going to be the new normal. You need to interact more on the web and maintain social distancing. Next slide. So this is a very good illustrative example. There are categories: patients with no prior cardiovascular disease, some with cardiovascular disease who test negative, who test positive, and some advice for the healthcare workers. So the general prevention is hand washing, clean, disinfect, avoid close contact, stay home if sick, social distancing. Somebody who turns to be positive, we need to watch out for the cardiovascular sequelae, the myocarditis, heart failure, cardiogenic shocks, acute coronary syndromes, venous thromboembolism, stress cardiomyopathies. The heightened awareness for COVID positive patients with cardiovascular disease, we need to be more prompt and watch out for any kind of toxicities of medications and any complications that a person might face. For healthcare workers, they need appropriate PPEs, personal protective devices, limited professional gatherings, and self-assessment of exposure and symptoms. Next slide. This is mainly how a cardiologist can avoid any kind of virus transmission to the patient and vice versa. It is not just the patient who coming to the hospital who is at risk, it is the doctor. He might be an asymptomatic carrier. So these are some of the procedures that need to be planned and to be done. Next slide. For those at risk, anyone during the pandemic who is at risk for development of cardiovascular disease should follow all the lifestyle modification guidelines, consult your doctor sooner, de-stressing is important, learn to live the new normal or make it the new normal. Next slide. We have to learn to be joyful, positive thinking. Prevention is better than cure. I always stress on that. Lifestyle modification, number one, adaptation and survival of the fittest is going to be in, next slide. So, this is just a pictorial description, long back in 1962, I found this on the web. It's scary, to look something like that. We would be having our own personal cars, but I don't think it's going to be that scary. We would get out of this eventually, but maintain social distancing. Next slide. So what is the need of the hour? It's funny, but I didn't know that men stand for mouth, eyes, and nose. Prevent your mouth, protect your eyes, and do not rub your nose. Wear a proper mask. Instead, follow women. People love to follow women, I'm sure. Wash your hands, obey social distancing. Mask is the priority. Exercise and eat well, and no unnecessary traveling and social distancing. Next slide, please. I think I'm taking too much time. Lockdown, you can only go 4 ways: come out as a monk, hunk, or a chunk, and choose wisely. Next slide. So, this is from Shivani. She's also a great Brahm Kumari and a teacher. So, in her words, चलो आज थोड़ा मुस्कुराते हैं अपनी जिंदगी के साथ, दूसरों की जिंदगी भी खुशनुमा बनाते हैं. याद रखिए, परमात्मा ने मुस्कुराने का ये गुण केवल हम मनुष्य को दिया है. अगर आप सच में परमात्मा को प्यार करते हैं तो सब उनकी खुशी के लिए हमेशा खुश रहें, मुस्कुराते रहें. Next slide. So, before I thank everybody, I would like to conclude that we just need to be more prepared and protected and face whatever the challenge we have, and we will come out of it. And thank you so much for paying so much attention to what I had to say, and thank you for providing me this platform. I'm open for any questions and answers.
The technical team, do we have any further questions on this session?
Ma'am, we can take it at the end together.
Okay, okay. Thank you, Dr. Sukriti Madam, for throwing insight on the cardiologic perspective. I hope we have the question and answer session at the end. We welcome our next panelist, Dr. Thanu Singhal, consultant pediatric and infectious disease at Kokilaben Dhirubhai Ambani Hospital and Medical Research Institute, Mumbai, having 11 years of experience. Doctor has done MD in pediatric from AIMS, New Delhi. She's also an MS at Tropical Medicine and International Health, London School of Hygiene and Tropical Medicine, London, UK. Madam has held many offices as a national convener of IAP Committee on Immunization, Executive Board Member, Fungal Infection Study Forum, member of National Technical Expert Group for Pediatric Tuberculosis, advisor to ICMR for Antimicrobial Stewardship. Doctor has under her cap 70 publications in national and international journals, 2 books and 20 book chapters. Her area of interest includes multi-drug resistant tuberculosis, antimicrobial resistance, epidemiology and biostatistics, travel medicine, infection control, and vaccinology. Over to you, Dr. Thanu Madam.
Yeah. So good afternoon, everybody. And it's really a pleasure to be here on this platform because I normally speak to doctors, but here I'm talking to a different group of people, and I've tried to make my presentation, simple so that it can be understood by all of you. So till now you've heard people talking about COVID-19 and what has been happening, and now I'm going to talk about what we are going to do post lockdown. So let us first talk about the current situation in India. And I mean, this is from yesterday's data. It's a little old, I guess, because things are changing on a daily basis. But we have more than 1.5 lakh cases and about 4,500 deaths. Case fatality rate is about 3.5%. But the question in everybody's mind is that are these the real numbers? And I feel that these numbers are definitely an underestimate because we know that many asymptomatic or mildly symptomatic people are not tested. And you must also remember that everybody with the disease does not test positive because the tests also have that limitation. So we may actually be looking at even 10 or 100 times the number of cases which are being reported. And that is in a way good and bad. Bad because, we have many more cases, but good because then the case fatality rate is actually lower because deaths are unlikely to be missed, unlike the number of cases. So actually it is thought that, the actual case fatality may be between 0.5 to 1%. Please don't change the slides till I tell you to. Next slide, please. Okay, so this is just to tell you what has been happening in India since since February, because we had basically very few cases, and then they started increasing, and we then started, and somewhere around 25th of March, a lockdown was announced, and at that time there were only about 646 cases in the country. And then there has been a steady increase in cases, and it's just going up every day. And now almost 5,000 cases are being reported on a daily basis. The other thing which is important to understand, and what was also seen in the previous slide, is that the number of cases are not uniformly distributed throughout the country. So Maharashtra, Delhi, Tamil Nadu are some of the areas which have the highest number of cases. Gujarat and Mumbai is actually the epicenter of the disease. And I was reading that it is among the top 4 cities in the world as far as the number of cases is concerned. And we are also seeing a lot of cases coming to our hospital, and many of them who are very sick and who cannot make it. And we also know that there has been a withdrawal of lockdown starting almost 4th of May. However, this withdrawal of lockdown has been variable throughout the country. Some areas have been quick to relax the curbs, and some areas like Mumbai have yet not done. And it all actually depends on what is the prevalence of infection. But you can see that the number of cases is rising, and this is going to continue to be like this. Next slide, please. But we all know that this lockdown cannot continue forever, because the lockdown was mainly aimed to flatten this curve and give an opportunity to the government and the civic authorities to build capacity, so that they can handle the number of cases that come in. And we also know that this lockdown, as has been discussed by the previous speakers, has a lot of serious social, mental, and economic consequences. And all of us are reading about daily wagers and migrant workers. And therefore, it is impossible to continue a lockdown, and there will be a graded withdrawal of lockdown over time in all areas of the country, as has been the case in various areas of the world. And we have to learn to live with the virus. So this lockdown is not going to continue, and we've already started withdrawing from the lockdown. Next. Now, so the question in everybody's mind is that what is going to happen now? Because once the lockdown is lifted or is in the process of being lifted, we were seeing a rise in number of cases even when the lockdown was in place. So, people will also think that why was the lockdown done? Well, the thing is that if the lockdown was not done, the number of cases would be 10 times higher than what they are now. So once the lockdown is lifted, the cases will increase. But how much will be the increase? It is very difficult to predict, because it depends on a lot of factors. It depends on how prevalent is the infection in that area. And you must understand one thing about COVID, that, this virus spreads more by close contact. So, even if there is a lockdown, we have a family staying together. And if one person is going out and is getting infected, then he has the potential to infect the rest of the family members. So that is why there is a limit to what lockdown can achieve. So cases which have a higher prevalence of infection like Mumbai will continue to see a massive rise once the lockdown is lifted. It also depends on what will happen to public transport. So if metros and local trains and local buses start running, and intercity trains start running, interstate trains start running, then there will be a rapid increase in the number of cases. It will also depend on social distancing and masking. So, like we heard first speaker talk about Taiwan and South Korea, that they were able to control the virus very well because they lifted the lockdown but continued social distancing and masking. Now that is possible in those countries, but in India, with its population density, it will be very difficult to ensure good social distancing and appropriate masking. It will also depend on climatic conditions. So, for example, we know that low temperatures and humidity favor the spread of the virus. So, those areas which are going to see monsoon may actually see an increase in the number of cases. And some cities in North India where there is a massive heat wave may actually see a temporary cessation of the cases. And finally, it also depends on herd immunity, because it has been the experience in other countries like Italy, Spain, the US, that, the peak lasts for about 2 months. And after 2 months, the cases gradually start declining. And part of it is to do with development of immunity amongst the local population. But all I can say is that even after looking at all these factors, nobody knows, nobody can predict, and we'll have to take one day at a time. Next slide, please. So now I'm going to come to talking about post-lockdown safety, which is personal, basically for educational institutions, because many of you are involved with them, and also about offices. So before we talk about post-lockdown safety, next slide, please. Let me talk about some basics about the virus, which we need to remember so that we can institute appropriate protective measures. So the first thing is that it spreads mainly as a droplet infection, and these droplets travel for 1 to 2 meters. So that means if you maintain a gap of 3 to 6 feet from another person, the risk of infection goes down. And also you need to be in constant close contact for you to be infected. So if you've had just casual contact, maybe for a few minutes, the risk of transmission is low. The other thing is that it is highly contagious. We all know that. And the risk of transmission is more in closed spaces. That's very important. And therefore, many people ask the question, can we go out for walks, with our masks on? I think that is safer than most things, because in open areas, the transmission is not so high. The other thing we must remember is that the infectivity is maximum in the first few days and almost negligible after the first week. This is very important to understand, because people who get infected should isolate themselves on the first day itself, rather than isolate themselves once they get the results of the test, which may take 2 to 3 days to come, because by then transmission has almost occurred. And the other important thing to remember is that after the first week or 10 days, or when a person has clinically recovered, they don't spread the infection to others. And therefore, you don't need to really isolate or quarantine yourself for a very long period. The other thing you must remember is that many infected people are asymptomatic. So you don't know who is actually infected and who is not. So you have to, in the current situation, you have to assume that all people whom you are meeting with are actually maybe COVID carriers. And in fact, the people who have got COVID and have recovered from it are actually at the least risk of transmitting the infection to others. Whereas, what is happening right now is that people are very scared of people who have recovered and come home. They are avoiding contact with those kind of people, but they are actually the safest people to interact with, because they are not going to transmit the infection to you. So that is also something which you have to bear in mind. And we've already heard that the disease is more severe in men, those people who are obese, those who are aged above 50, and those who have other health problems. So that means these are the kind of people who have to take more care of themselves. The other thing to remember is that in this disease, deterioration usually happens after the first week, so that the disease gives time. That means that, you have time to access healthcare services and access medical care. But it also gives you one important information, that you have to be careful for at least 10 days after you get afflicted, because many people after 2 to 3 days, if they start feeling well, they feel that they are over it. But no, we've seen people who are feeling well for day 7 and then they start having a problem. The other thing to remember is that once worsening starts, it's a very rapid downhill course. So once you start becoming sick, the disease doesn't give you time then. Then in a day or two, you can actually end up on the ventilator. And the other thing which is horrific is that people may not realize they are sick. So you hear the term happy hypoxic. So people will just feel fatigued and they will just feel ill. And, when they feel that they're just tired, but when they actually go to a hospital and their saturation is checked, they are very sick. So close monitoring is very important. And there are very few treatment options and there's no vaccine yet. So we have to remember all these things when we start opening out and we start going out for work. You have to remember all these things, and that is how the rest of my presentation is based on. Next slide, please. Now, what are the personal measures that we should take post-lockdown? So the first thing, it depends on the local prevalence of infection. So if somebody is staying in the Northeast where there are very few infections, they don't need to be very careful. But people who are staying in crowded metropolitan cities like Mumbai, Kolkata, Chennai, New Delhi have to be very careful. You always have to follow the local city guidelines, because every city civic authority has its own guidelines. They have their own helpline numbers. You have to follow that. You also have to, look at your individual health status and needs. And a common advice or a sensible advice is that people who are above age 60 and those who have comorbidity should not go out as far as possible. Because, these people, if they catch the infection, then they are going to have a difficult time. The others should go out only for essential work. So this is not the time to go shopping into malls, even if they have opened. This is not the time to go into restaurants. This is not the time to go out for a pleasure holiday by drive, etc. Avoid crowded areas as far as possible. Try and use private transport and self-driven vehicles. So, even if you have a driver, but you can drive yourself, it's much better to drive with windows down. And even because, sometimes we've seen people who get infected from their drivers because they are sitting in an air-conditioned car for 1 hour, and then transmission of infection is very easy. Minimize visitor entry in the house. So, many people have, maids, multiple maids coming into their house for work. So they should try and see that how they can do with the least possible household help. Of course, this is not to say that whatever help you have, you cut their salaries or don't give them salaries. You continue to pay them whatever you can, but try and see how much work you can do yourself. Do it yourself. Wear a mask at all times when you're outside the house, and you have to wear it properly. You can wear a cloth mask. You don't have to touch the outside of the mask. Keep it over the nose at all times. And once you come home, remove the mask and wash it. Don't use it again without washing it. Hand sanitization every 20 minutes is important, because when we touch a surface which has the virus and then we touch our nose and mouth, we infect ourselves. So that means if you use a hand hygiene every 20 minutes, you're destroying the virus on your hands. And hand sanitization has actually stood the test of time. Maintain social distancing, and after returning from work, shower, change clothes, and then mix with other people. And especially if you have elderly people in your house, you have to kind of stay away from them, see that they stay in their room as far as possible. Next slide, please. Keep the house well ventilated, keep windows open and allow sunlight to enter. That means, if you have an air conditioner in your house, but you also have windows, it's always better to keep the windows open. Good surface disinfection is important. Eat and sleep well, because you need all the immunity that you have to fight this virus. Have positive mental health, and that has been discussed earlier, so I'm not talking about it. But don't spend too much time on TV and WhatsApp, because the moment you actually open the TV, there is shouting going on at all times where people are criticizing each other, and that is exuding a lot of negativity. And you have a lot of WhatsApp messages circulating, and people are all the time glued to their screens. You have to download the Arogya Setu app, because it warns you if there is a person who is infected in your vicinity. And you monitor your self-health and symptoms and isolate and get tested immediately. That is extremely important, because what happens is, in today's stigma world, people think that if they have mild symptoms of fever and cough, they don't want to get tested, because if they get tested, then if their neighbors will come to know that they are infected, the civic authorities will come to know, they might come and seal the building, and all those problems happen. They may ask to go and stay in a quarantine facility, and their family members may be discriminated against. But you have to remember that the benefits of getting tested are more than the problems of getting tested, because once you get tested and you are positive, then you are going to take isolation very seriously. So, you have a person who has cold and cough, and you say, yeah, you could have COVID, so why don't you isolate yourself at home? Versus a person, you say that you have COVID and you have to isolate. The degree of isolation is clearly different. The other thing is that if you get tested and you are positive, you will monitor your health carefully. And once you are positive and you recover, then you know that you are immune for at least some time, and you will be more confident in taking on the world. And the next time you get a cold and cough, you don't have COVID and you don't have to worry, because it's very clear that once you get COVID, you are immune at least for some time, and you don't get reinfections. Next slide, please. Now, as far as educational institutions are concerned, the decision will be by the city or state, because they will allow institutions to open. But each institution has to decide that, do you really need to open? Is online learning an option? So many people say that, children and adolescents get very mild disease and will recover fast, so we don't need to be worried about them. But it's not only children or adolescents or young people who come to institutions. You have support staff and you have teachers. And mind you, anybody who's above the age of 40 or 50 has a hard time dealing with this disease. And also, if a student gets infected in the educational institution, they will fight off the disease. But what about their parents or their grandparents when they go home? Will they not transmit infection to them? So we'll have to think of all these things. Next slide, please. So if the institutions are indeed open, then I have a few suggestions, because we do the same thing in our hospital, which is also actually like an institution. So try and give leave to those above 60 and those who have comorbidities, and maybe give them the option of online teaching or preparing course material or evaluating mark sheets, etc. Restrict entry of students who come from containment zones. Reduce crowding in your college by allowing only batches to come in. And one good idea is to allow one batch to come in for 15 days and then give a break for 15 days. rather than asking people to come alternate day, because that way everybody gets exposed. So this is what some hospitals also follow, that they allow one set of staff to work for 15 days and then give them a 15 days break, so that the risk of spread of infection is less. Always restrict entry of ill students or those whose family members are sick with febrile illness. So you have to have that advice out that if somebody feels ill, they don't have to come in, or if their family members are sick, then also they don't come in. They should all have Arogya Setu on their smartphones. And as an educational institution, you should tie up with a hospital or a healthcare provider who can provide medical assistance if needed, or advice if needed. Next. And, many people talk about thermal guns, that people, once they come in, will use a thermal gun. But you must understand that these thermometers are not accurate and they give a false sense of security. And 50% of the patients with COVID actually don't have fever. Ensure that there's universal masking in the college campus. Keep distance between students in classes. No handshakes. Keep windows open as far as possible. Make sure that there's good surface disinfection done with hypochlorite, and restrict the time that students spend in school to only 3 to 4 hours. Don't keep any breaks. Just give them 4 hours of constant study. Keep the batches constant, so that if you have to quarantine, then you always quarantine the same set of students. Keep the canteens closed. Keep play areas closed, and don't allow any eating in the premises, because that's the biggest risk factor. Because when people eat together, then they remove their masks, and that is the time when people actually get infected. Next slide, please. What to do if one student tests positive? So basically, if all the students have been wearing masks and the student himself or herself has been wearing a mask, it's a low risk exposure. So you don't need to quarantine the other students in the class. You allow them to monitor their temperature and health. And if they get positive, if they get these symptoms, then they are tested. Whereas the student who tested positive can join 2 weeks after onset of symptoms, and there's no need for a negative swab to be done before the student joins back, because now, as per the national guidelines, you don't need to prove swab negativity. You assume that after 10 to 14 days of becoming infected, you are no longer infectious to a person. Next slide, please. And what about offices? Because many of you who are listening to this webinar are also going to offices. So the same principles as the school apply in offices also. And offices also have to think that which staff can actually work from home and don't need to come in. Give leave to elderly and those with comorbidities or pregnant staff. Can split the office batch into batches to avoid overcrowding. So you can either have a morning evening shift, or 2 weeks on and 2 weeks off. Restrict time spent in the office. Discourage people eating together in office. Make sure that they carry their own tiffin and they eat in their own cubicles. And even if you are holding an office meeting, try not to get together in one room and hold a meeting, but do it on the web, or do it on platforms like Zoom or other such web platforms, even if the people in the office are still there on the campus. Next slide, please. And even in the offices, ensure good disinfection, ensure that all the staff has insurance, tie up with hospitals who can provide care to a positive staff member, because sometimes what happens is in this COVID scenario, getting a bed is very difficult. That is the issue. So always see that if somebody is positive, you have a tie-up with the hospital who can take them. Plan for a contingency, and also plan that you might have to close down the office in case there is an outbreak. Next slide, please. So I think with that, I'm kind of concluding my presentation and saying that, as all the speakers have said before, that there are two worlds, before Corona and after Corona, and there will be a new normal. And this situation may last for months or even a couple of years, and we'll be really lucky if it gets over in a few months. The social distancing, masks, and hand hygiene are the three pillars of protection. They have to be followed all the time. Always follow the rules and guidelines of the civic authorities, even if you find them irrational, but you have to stick to what has been told you. And remember that this is not the last pandemic of our lifetime. And pandemics like these are going to come. And what we should do is that in this pandemic, we have to get our act together and learn from here, so that if something like this faces us in future, we are better prepared. Thank you. Now, if there are any questions, I would be happy to answer them.
Thank you so much, ma'am, for this wonderful session. It was really fruitful. Thank you for all the practical tips. We have a question over here. Australia, Germany are doing COVID-19 test to every citizen individually for free. Then why India is waiting for COVID-19 to be tested only when we have symptoms? Life is more important than money and wealth. I think we are waiting for herd community.
So actually, that is not entirely correct. That all these people are testing asymptomatic people. I don't think that's true. They might be treating asymptomatic contacts, close contacts. I think India is doing a good job of testing as far as possible with whatever resources we have. And we are focusing on testing the symptomatics because when an infection has spread so widely, what you actually want to do is that you want to test people who are ill so that you can monitor them better and you can refer them to hospitals better. And so each country has to think about how they can best utilize the resources. Next, is there any other question?
Professor Umakant, you had raised your hand in the last session, so you can ask your question now.
Hello. Hello.
Yes.
Madam. I heard about how we can take the precautions during the this COVID-19 in school and offices and all these things. But my question is like this: you are working in hospital, and in remote places or in district places also, there is worst condition in civil hospitals. And so for that, if the patient is in good condition, when he enter into the civil hospital, then he will be kept along with that corona positive patients. And from that, he will get disease, and perhaps death will also attempted. So in such cases, whether is it possible to convey to the government to clean the civil hospitals?
So I'm not, I'm sorry, I don't work in that setting, so I don't know about it. But most hospitals have separated out wards which handle COVID patients versus non-COVID patients. But we must understand that that separation is never absolute, because you may sometimes have a person who comes into the, and because as the earlier speaker said that COVID has a variety of presentations. So you can have a patient coming in with pain and diarrhea, abdominal pain, who may turn out to be COVID. You may have an MI patient who turns out to be COVID. So while all hospitals try and separate patients, sometimes it is not possible and mixing does happen. That is why it is very important for people to try and avoid going to hospitals as far as possible, seek help through teleconsults. And if they are actually need hospitalization, then they go. But I mean, I don't think all hospitals are trying to separate these patients as far as possible. But we have to understand that when we are in a pandemic situation, everything is not as per, because everybody is struggling with manpower, everybody is struggling with resources. But I can at least tell you for Mumbai, we have a lot of civic hospitals here in Mumbai who are doing an excellent job in separating COVID versus non-COVID patients.
It is possible in Mumbai, but in remote places like in district places, there is.
So yes, but I mean, that is something which you will have to convey to the civic authority. Unfortunately, I'm not the right person to, convey that message to the government.
No, but you are related to that. If somebody, you are staying in Mumbai. So suppose if in your suggestions, if you put that, then it will also go better. Okay.
Yes. So that is very important. That separation of COVID versus non-COVID patients in hospitals is very important.
Maria,
one question is there from YouTube.
Yes, ma'am, please ask.
One question is there from YouTube. He's asking, what precautions should we take for kids to increase their immunity?
Okay, that's a very nice question, because everybody. So one thing I would like to say is that children are actually do the best as far as COVID is concerned, with a few exceptions. So actually, you have to be more worried about elderly parents than the children. But as far as immunity boosters are concerned, there's nothing which has really stood the test that something really works. So there are a lot of homeopathic medications floating around like arsenic and all that, but there's no clear data that they protect. So I would actually not recommend that you give a lot of remedies which you hear about on WhatsApp, etc. The other thing, other vitamins which are known to help as far as COVID is concerned is vitamin D, vitamin C, and zinc. So you can actually talk to your pediatrician or doctor and give your children these vitamins. But how much they are going to protect them is really uncertain. But you can at least do that if you want to, because sometimes doing these things also gives you mental satisfaction, and that is very important in the COVID times, because a lot of things have to be fought in the mind. So sometimes people feel, yes, they're doing whatever possible to protect themselves and their children. But I think the basic things are that ask the children to stay home as far as possible. Ask them to eat well and sleep well, not, keep glued to the TV all the time, and follow the precautions of masking and hand hygiene when they go out.
Thank you.
Yes, and one more point, that vaccinations should not be delayed, because right now what's happening is people are not going to their doctors for vaccination. So now is the time to set up appointments and at least get the children vaccinated, especially those who are below the age of 1 year, because they may actually then have other problems. So please make sure that at least for children below 1 year, their vaccinations are completed.
Thank you so much, Dr. Thanu, for being with us and throwing insights on how to handle COVID-19 with care post-lockdown. It was in a very subtle explanation. We are indebted to you. And thank you once again on behalf of Vivek College of Commerce.
Thank you. Thank you. It was nice interacting with all of you. Thank you.
Thank you. So this lockdown has brought some positive impact also. The mechanical life which we were leading, locked up in our own work, locking our passion and hobbies, has thrown this lockdown by opening the doors of inner passion of everyone through form of art, music, creativity. Here we present to you our admin staff's creativity. May I request the technical team to play the video?
ये भारत देश जहां सूरज की पहली किरण से होती है दिन की शुरुआत, थम सा गया है हर लम्हा चाहे वो दिन हो या रात। कहते हैं विदेश से आई इस बीमारी अमीर गरीब सबको अपने साथ ले जा रही है। अमीरों को बस कोरोना, पर गरीबों को तो खाने की चिंता भी सता रही है। ये वो लोग हैं जिनकी वजह से हम अपने घर में हैं सुरक्षित, मिलकर उनके लिए दुआ करते हैं ताकि इनकी मेहनत से हो सबकी जीत। ये देश के दो वीर, एक खाकी वर्दी में और एक सफेद कपड़ों में, कोरोना की मार को झेल रहे हैं। हम सब की जान बचाने के लिए अपनी जान से खेल रहे हैं। जाति धर्म पर लड़ने वाले हम आज साथ मिलकर कोरोना के पीछे पड़े हैं। कौन हिंदू कौन मुस्लिम, यहाँ तो सारे हिंदुस्तानी खड़े हैं। हर उस मेडिकल स्टाफ को सलाम जो इस कोरोना की रेस में है शामिल। हर घड़ी आपके लिए दुआ मांगेंगे सारे हिंदुस्तानियों का दिल। खुद के घर से दूर अपनी जान से आज हर एक डॉक्टर खेल रहा है। कोरोना को लोगों के पास जाने से पहले वो अपने आप पे इसे झेल रहा है। सब मिलकर आज हम उन लोगों के बारे में सोचते हैं जो हमारी खातिर आज बेझिझक ड्यूटी पर पहुंचते हैं। अच्छे दिन तो अब आए हैं दोस्तों, कुछ पल हम अपने परिवार को दे पा रहे हैं। रह गई थी जो बातें अधूरी वो अब किए जा रहे हैं। किसी को कैदी बनाकर रखने की तकलीफ आज हम सब जान गए। इनको आजाद घूमते देख हम कुदरत का करिश्मा मान गए। कुछ गैर जिम्मेदार लोगों की वजह से हम आज भी कोरोना से मुक्त नहीं हो पा रहे हैं। हर तरीका आजमा लिया हमने, पर ये लोग समझ ही नहीं पा रहे हैं। इस कोरोना नाम के शैतान का मुकाबला देश को करना ही पड़ेगा। जीत हो या हार, अब तो हर हिंदुस्तानी इससे लड़ेगा। हर कठिनाइयों से लड़ते आए हैं हम, इस जंग को भी जीत लेंगे। इन सब के साथ हम अपनी सुरक्षा खुद करना सीख लेंगे। खुदा करे सुरक्षित रहे हम सब और इस कोरोना की संकट से बच जाए। इनके आशीर्वाद से दुनिया में फिर एक नई सुबह और नया सवेरा आ जाए। एक दिन जरूर आएगा जब हम सब इस कोरोना को मिलकर हराएंगे। कितनी ताकत है हिंदुस्तानियों के जज्बातों में, हम पूरी दुनिया को दिखाएंगे। आप सबसे एक गुजारिश है, कोरोना के बाद भी हमें खुद का ख्याल खुद से रखना है। हर एक प्रिकॉशन लेके हमें अब इस कोरोना से बचना है। धन्यवाद।
Thank you, admin staff, for that wonderful presentation of creating awareness of coronavirus. Small acts, when multiplied by millions of people like doctors and teachers, can transform the world. May I now invite Dr. Neelu Khosla Madam to propose the vote of thanks. The feedback link will be provided in the Zoom platform as well as on the YouTube. Over to you, Neelu Madam.
A warm and graceful good afternoon and good day to each one of you. It's my privilege to propose a vote of thanks on behalf of College IQAC team and University of Mumbai to all for being there for this international webinar COVID-19, which has its impact on our everyday life. On behalf of my fraternity, Vivek Education Society's Vivek College of Commerce, we sincerely thank the Almighty for making today's event a resounding success. Hearty thanks for the chief guest, Dr. T.A. Shivari, Director Education, Wilson College, preparing us to face new challenges for adopting new ways of e-learning and for showing us a new path to teachers. Special thanks to our patrons from the University of Mumbai, Honorable Vice Chancellor, Professor Suhas Pednekar and his team, Professor Kulkarni, Dr. Deshmukh and Dr. Bhamre. The special thanks to the panel of distinguished guests and doctors who represented different parts of the world, shared here their views, they exchanged their ideas, they made us understand things in detail, all from the field of medical faculty. Our sincere thanks to each one of them, and we look forward to interact with them in future also. We extend our thanks to Dr. Rekha Behrot and to Dr. Bhavik Patel for their support extended by them. My special thanks to our President, Sri Ram Sir, and his team members, especially when they always stand with us and see to it that they are with us till the completion of task. And they always spare their valuable time to be with us despite their busy schedules. Thanks a lot for all the members of the management. The support extended by the Principal Dr. Shetty and her proactive approach and her enthusiastic attitude to make us stand together and to make us do the best out of us encourages us to take the best out of it. Thank you, ma'am, for being there, Dr. Shetty, Principal, Vivek College. Friends, no event happens overnight. The wheel starts rolling weeks ago. It requires lots of planning, and we are fortunate enough to have dedicated staff of the IQAC team members, the teaching faculty of Vivek College of Commerce, and the administrative staff. They've all put their efforts together tirelessly, and for this, we were able to make this event a great success. My special thanks to each one of them for being there. Special thanks to all the participants for being there and making this a day. Last but not the least, we have two young professors, Professor Mayur, Professor Murgesh, and the team of technical support for their efforts to anchor today's events. Thank you to both the young minds together with their team. Both worked beyond their comfort zone and have made this dream come true a reality. Thank you to each one of you for stimulating us and making this a successful webinar. Thanks once again. Thank you, Maria ma'am.
Thank you, Dr. Neelu Khosla Madam, for that wonderful proposal of vote of thanks. Have a heart that never hardens, and a temper that never tires, and a touch that never hurts. Thank you all the participants once again for being with us for this international level interdisciplinary webinar in the theme Overcome COVID-19 Pandemic through Nuances of Life. Thank you once again. Have a great day. This is Maria signing off. May I request the technical team to end the webinar.